Welcome back to the Inhuman Performance Podcast. Before we started today, I just wanted to say thank you guys so much for all the kind words on my interview with Cameron. If you guys haven't seen that, go check it out. Went over super well. As for today, my guest is Shayan Safar. He is a doctor of physical therapy, a stuntman, and a purple belt under Rodrigo Carvalho. Shayan, thank you so much for coming on, my man.
Thanks for having me. I got to follow Cameron's footsteps. That's not easy.
No, well, bro, dude, it is going to be easy, mainly because I butchered his last name. But
nice. Hey, you nailed mine.
Oh, I did?
Very impressed.
Okay,
yeah,
thank you.
Shayan.
Yeah, I tried. But yeah, so, you're obviously a doctor of physical therapy. And the first thing I wanted to ask you about is, physical therapy school. Like, how was it? What was it, difficult or?
Yeah, it definitely pushed me to at least become a better person. I mean, for me, the school part wasn't necessarily very, very hard. Like, you just had to be on top of it. Because I thought the material was so fascinating. Like, I had no problem paying attention in class and showing up. The hard part for me was I have so many other things that I'm passionate about,
right,
and juggling all that. So when PT school started, I wanted to keep training jiu-jitsu every day. I still was doing stunt gigs. So I picked a physical therapy school in Los Angeles. I still wanted to surf. So I started waking up at 5 a.m. so I could do jiu-jitsu at 6 because I had class at 8. And so it was a grind to balance it all. And it kind of still is because now instead of school, I'm working. But yeah, I mean, I think because it was so cool, like it was just fun to learn it, but definitely challenging, 100%.
Yeah, for sure. And dude, that's one of the things that I've noticed about you, just getting to know you, like, seeing you in the gym and stuff, and, even meeting you outside of the gym. Your time management is truly exceptional. Like, I have yet to meet a person who is like capable of managing all the things that you do.
I don't know if I really do it. I think I'm just like floating on thin ice sometimes,
Well, I don't think anyone really does. I just think I just think it's a matter of like how much you can, handle throughout the day. Yeah. But like, even when we did the stuff for my surf brand, Ganja Surf Wax, when we filmed that little thing, we were up super early and you're like, oh, and I have to go somewhere after this. And after that, I'm on my way to do this. And I'm just like, Jesus, dude, like, that time management must be a strong suit of yours.
It is. I'm actually trying to change it because actually I don't know if it is the healthiest thing. Like,
right.
I do believe, like when we talk about, I'm sure we're going to get into this more, but like meditation and things like this, right?
Dude,
and there's the almost superhuman effects of doing stuff like that.
Yep.
I think also not having your lifestyle be where it's like, from 10 to 11, 11 to 12, right, 12 to 1, like with a 10-minute window and this and that.
Yeah, time blocks.
Time blocks. I mean, obviously you need to be an efficient human. I'm not saying we shouldn't, but with balance, right? Like if I do that too much, I never get that time to reflect. I'm never out of the, sympathetic nervous system. It's always go, 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 go. And I felt like sometimes I get burnt out from doing it. It's just hard because everything I do, I love. Like I love physical therapy. I think it's so cool. I love jiu-jitsu. I love surfing. I love stunts. So when I wake up, it's not like a chore. It's more just like, oh, how much cool stuff can I fit in today?
Right.
And then so I'll start with very noble intentions. Like, yeah, I'm just going to pick one or two things. And then you'll hit me up. You're like, let's go to the beach and shoot. And I'm like, I'm in. And then someone's like, hey, you want to drill before jiu-jitsu class? I'm in. Yeah. And then, hey, can you come look at this? I'm in. And then next thing you know, it's like, okay. But yeah, no, I mean, that's a good thing. It's fun.
Yeah.
So, but.
Well, I definitely think, burnout is something to be, very cautious of. I think I don't know how many years you've been doing this kind of time schedule, but it seems like it's been a while.
Yeah. I mean, I think physical therapy school is when it really started getting a little really intense. Before that, it wasn't so bad. When I finished high school is when I started kind of like, I feel like hitting my stride and figuring out who I was. And I got into breakdancing first and was a professional dancer while I was in college, and then to stunts and all these other things. So from then I was pretty busy because I just was like trying to fill my day with cool things. And just as time has evolved, it's gotten progressively busier because there's either more hobbies that I'm into or more opportunities. So at least since grad school, my time management has been kind of like pretty regimented.
Well, that's seriously impressive. The fact that you're able to cram all that stuff and be really good at like a lot of it. Like,
I don't know about all that, but I appreciate
dude, come on, bro. I was actually, when I told my partner about the shoot that we were doing, he's like, did you just find some bum surfer? And I was like, no, dude, the guy's pretty good, bro. Like, the fact that you're able to be proficient in so many hobbies, I think is seriously impressive. And the fact that you haven't burnt out is also really incredible. Like, I think that's, that's one of the reasons why I wanted you on, is you're like, an exceptional human. It's really just impressive to watch, and like kind of mirroring some of your tactics would be, very useful for me. And, even just your mindset, I think it's also, really, really interesting and good. And especially the mindfulness and meditation thing. I'm glad that you pay attention to that. That's, neglected by a lot of people, in my opinion.
It's next level.
For sure.
It really is.
And we'll talk about some of the studies 100%. On that, because I just read up on a lot of studies that have come out recently on 10 minutes of mindful meditation practice a day. But as for now, I wanted to ask you, how did you get into the stuntman stuff?
So it was kind of...
And if you could keep the mic a little...
Oh, yeah, absolutely.
Yeah, just a little bit closer.
No worries. It was kind of a funny story. So when I was at UCLA for undergrad, I was doing dance gigs. I was a break dancer. I toured with LL Cool J. I did some TV shows, and again, time management. I was really busy, and I remember at that time being like, "Man, I'm just between being a college student and then I was a dance teacher and doing gigs. Like, I can't really do any free things anymore." And not to be like, "Oh, I'm above that." It was just time management. Like, hey, And then so I'm training one day, and I'm training acrobatics. And I make some joke about me being Persian. And the guy I'm training with is like, "Dude, you're Persian?" I'm like, "Yeah." He's like, "Hey, this sounds really weird, but I have a friend who's making a short about, he wants a Persian breakdancer who can do martial arts for a comedy short about dodgeball." And I was like, "What is this?" So it was so random, but he was my friend. And I was like, "All right, yeah, man, I'm in." I was like, I just have to see what's going on, because I've never heard anyone look for this like specific casting.
That's a very specific like.
I was like, this is ridiculous. This might be destiny. You know what I mean?
Yeah.
And in a funny way, it was, because what happened is, so he's like, "All right, I'm in," or I say I'm in, and I show up to the rehearsal. The director, who's like now one of my best friends, who I never met before, is a Persian stunt guy. And it happened to be at this training facility, the stunt house called 8711, which is like one of the top stunt teams in the world. They're doing everything. The guys who started it now are the directors of the John Wick series, which everyone knows and loves. Like, we're talking the best of the best. And I had no idea what I'm walking into.
Right.
And I was just like, "Oh yeah, I'm down for this like little funny short." And then next thing I know, they asked me if I can get on wires. And I'm like, "Yeah, sure, whatever. I'm down." As a B-boy, as a breakdancer, like, we just do gnarly stuff for a Chipotle burrito. You know what I mean? These stunt people are doing crazy things, and they're getting paid really well. So I was like, "Yeah, I'm down. That looks really fun." So they put me up on wires, and we're doing some fun stuff with this. And I was like, "Hey man, like, I'd love to learn more about this. Is there like a way I can pay to like learn how to do this?" And they're like, "Bro, that's not how it works." I was like, "What do you mean?" I was like, "Dude, we get paid to do this." And I was like, "Really?" And they were like, "How much, if you don't mind me asking?" And they told me, and I was like, "Yo, my man, I'm interested." I always love doing the impossible. Like, that's what got me into breakdancing, because I thought these people that did it were superheroes, right? Like, I legitimately as a kid thought the people that do head spins were like circus people that were born funny, what I mean, different, and that they like, that was my thought process. Like, oh, they were born different, and they can just do it. I didn't learn like, oh no, man, you can do it. You just have to practice. These are just skills. It's like surfing. It's like jujitsu. And that's when things flip for me. So once I got a hit of that, and like I learned how to do head spins and these things I once never thought I could do, I realized like, yo, there's an infinite amount of potential within you. So I got addicted to like doing the impossible. So stunts was a perfect thing for me, because it's like, hey, we're going to drive a car off a cliff and somehow you're going to survive it. And I'm like, all right, that sounds impossible. Let's make it happen.
For sure. And what do you think that was like one of your defining moments, like in what kind of made you want to get into stunt, was just like doing the impossible? Yeah,
I think so. I mean, it was like I did dancing growing up. I did martial arts growing up. I didn't know that stunts was actually like a beautiful balance of the two, because you have to learn choreography, which is a very dance-esque thing as a stunt person. But then I liked martial arts. Like I did Taekwondo as a kid, more like the classic martial arts, not like mixed martial art type things.
For sure.
But yeah, so it was wild. It's funny even now reflecting on it and realizing, wow, that person asking me if I was down for that free gig, like that was a thing that took my life in a totally different trajectory.
Yeah.
That I could have easily just been like, nah, man.
Yeah, I'm good. Yeah.
And I would have never become a stunt person because of that.
For sure, dude. Yeah. I mean, I was, those events are always really interesting to me. Like when I wanted to start doing jujitsu, I like, I've always wanted to go to the gym that we go to, like, for a long time. My parents were just not okay with me doing martial arts for a while. So, but I don't know, like out of high school, I was just like, man, I really need to go to this place and check it out. And like one day on a whim, like it wasn't like I planned this out or anything. I just called and I was like, hey, I want to do a private lesson and, see how it is. And, now I'm doing, jujitsu and now I'm here. Like I didn't, it's crazy how things can just turn you around completely. Just one tiny little event. So.
Yeah, it's true. And like, that's something very commendable, because one thing I'm learning about people is there's a lot of times where we get stuck in analysis paralysis and we're trying to find the best opportunity, the best jiu-jitsu school. And a lot of these moments that are like so special that you reflect back on are not the ones that you spent hours researching what is the best. It was like, I'm just going to go do this.
Yeah.
Like, and then you're like, whoa, this is wild. Same thing with jiu-jitsu for me. Like, I wanted to do it because I started getting into watching UFC fights with friends. We would train stunts and then we would have the UFC fights. And then I actually remember seeing the Gracie brothers break down some jiu-jitsu stuff. And I was like, oh man, like this is really cool. I'm into it. Then one of my stunt friends knew about this deal that was happening at the gym that we train at, which is like, we're out in like Westlake Village, Thousand Oaks.
Yeah.
Nothing that I ever did that was cool growing up was in Westlake Village, Thousand Oaks. So they're like, hey, there's like the sick group on there for this deal. You should go check it out. And I was like, I don't know, man. And he's like, no, just do it. And then I went, and it turns out we have like one of the best teachers in the world there, who's super low key and humble. And it was like another one of those things that like, I didn't really think too much of it. I was like, I'm just going to go try it out. I just want to learn like take like 5 classes just to like, learn some stuff. And then I was like, oh no, dude, this is,
there's something here.
I'm in.
That's it, dude. I just, I found the gold mine too. You know what I mean? It's just crazy. Like when you first start and you start seeing how people can manipulate bodies, it's just like, God. It's crazy. It's so crazy. And you're right about our instructor, dude. I'd love to get Rodrigo on.
Shout out to him, because he is such a underground dark horse, like in the jiu-jitsu, and the sweetest human ever.
Yeah.
Like so like spends his time really just like having a good time training jiu-jitsu and then making sure everyone around him is good.
Definitely.
Like, truly. Like I've never met someone who in his situation is still so like generous. You know what I mean?
Yeah.
Like he's such a, oh my God.
And what's really interesting about that is the volume of people he manages. He still finds a way to, be caring. It's really very impressive. And he's so funny. Like he said, like I invited him. I was like, hey, if you need anywhere to go for Thanksgiving or whatever, you can come by my house.
I remember that.
And he's like, whoa, free dinner.
Yeah, it's like I'll go be at yours. I go be at his. Then I go to his. And I was like,
dude, he's great. But I'd love to get him on at some point. I think that would be cool. And yeah, if you guys, for those listening, go check out the Fight for a Kid charity. That's Rodrigo's charity, where he helps kids in the favelas in Brazil have opportunities and get jobs and train Brazilian Jiu Jitsu. It's really incredible the work he does, and he's just a great guy. So
amazing.
Yeah. But so to move on a little bit, what is like your secret? Like how do you do all the things that you do? Like I don't get it. I mean, like, I try and I'm a multifaceted individual as well. Like I try and do lots of different stuff, but like you just seem to have like such a control on things.
Man, I'll say, I don't know if I have like a secret. Like I don't have this like thing that's like, oh yeah, like low key I do this. But what I realized is when you start fitting in all these things that you like doing, you just naturally cut out things that don't serve you. Like I don't really watch TV, and it's not like I make an effort to not watch TV. I'm just so excited to go to jiu-jitsu, to surf, to do physical therapy, to do stunts, that at the end of the day, I'm just spent and I'm ready for bed. Like I didn't have time to watch TV, but again, it wasn't like, oh man, I really want to watch TV and I'm forcing myself not to. One of the things I learned in life is instead of focusing your energy on getting bad habits out of the way, you just focus your energy on instilling good habits. And then there's no time, there's no energy for the bad habits. Like, I remember, this is a really simple example, but like, I remember I was trying to get rid of, drinking like crappy sodas, right? So I didn't even actually think about that. I just wanted to start drinking more water. I didn't even have the idea of sodas in my head. I just heard, oh, it's good to drink more water. So like, this is high school. I was like, all right, I got to drink water. So every opportunity we had, I would drink water. And then I remember like after like months, I was like, dude, I haven't had like junky soda in forever, and I'm not craving it. And so I was like, oh, this is really interesting. I never gave any attention to that, because when you give attention to the bad habit you're trying to get rid of, you're thinking about it. Like if I always tell people, like if you're saying, hey, don't eat Oreos, what's the first thing that comes to your mind? It's
Oreos.
like, yeah, the like crunch,
Yeah.
the, I want to like whatever you do with it, whether you bite into it or twist it or however, instead of I'm like, hey, what's your favorite fruit and vegetable? And you're like, oh, it's mango, blueberries, whatever. It's like, all right, go stock your fridge with that.
Right.
That way you won't even think about the Oreos because you'll be so full. So for me, I feel like the secret is I just have these things that I'm really passionate about and I love. And I'm like, all right, let's do it. And then naturally along the way, like certain things come, certain distractions come into my life that I'm just like, man, I don't really have the time or energy to fulfill that. I'm so good. I'm so content. Like, man, a perfect day for me is like I wake up, I surf, I go train jiu-jitsu. I do a little bit of service for people around me. Like I love giving back. And that's the nice thing about physical therapy. I get to help people and then hanging out with my friends. Like that's it. That's a perfect day.
Sounds like a great day.
It's amazing. Right. Yeah. And so it's like, and honestly, it's not, you ask people what's a perfect day for them. Most of the time it's pretty reasonable things. It's not like I'm jumping off a $1 million yacht into the ocean of gold. Usually it's like, I just want to kick it with my friends and family and do something fun.
Yeah. Unless you're Conor McGregor.
Yeah. Well, hey man, we get it. Once he's on your podcast, you can see, he might just be like, hey dude, a perfect day is me hanging out with the family and
it could be,
and chilling. You know what I mean? Like we all have different means of doing that. But so yeah, for me, it was just like, I'm just stoked on doing these things. And I love getting good at stuff. Like I'm addicted to that level of achievement that like, again, doing the impossible. Like to be a black belt in jiu-jitsu is like, whoa, man. Right. I mean, to be a blue belt is like very significant, right? So to me, I'm like, all right, I want to get my black belt. Like I'm addicted to that idea. And not just for that. Like I love jiu-jitsu. Like even if belts didn't exist, I'm still there. But still like, I'm like, all right, like let's do this. Because honestly, as a kid, I wasn't an athlete. Like I wasn't like amazing at school. Like my parents are both very intelligent. I think I grew up in a family of like pretty academically smart people, but none of us are artists. None of us are athletes. I didn't have like this natural gift. I was actually like, I think I was like kind of a late bloomer. So as a matter of fact, in sports, like never got picked for the teams, nothing like that. But once I figured out like, hey, you can work hard and get those things that you want, I was like, oh, it's on.
Yeah, dude, for sure. And it's funny you say you use the term late bloomer. I'm definitely a late bloomer, if anything else. Like, in high school, dude, I was like an idiot. Like, I just didn't care. Like,
it's crazy to think of that because when I talk to you, you teach me things. So I'm like, bro, what is this?
Yeah, I appreciate that. But dude, in high school, man, I was just an idiot. I was such a moron. Like, I didn't care about school and I really struggled to pay attention to certain things. I felt like I was wasting my time.
Yeah.
And I really was just super into cycling. Like that's all it really is down at the end of the day. I just wanted to, get home and get on my bike and beat everybody else. That's really what it was. And it's interesting coming out of high school. I had a fresh perspective of what learning something was like.
Right.
And it's so strange how you're stuck one way of thinking. And then once you're out and alone, it's just like, whoa, like, there's so many more possibilities of how to do stuff and,
100%.
What to do. And, just figuring that out, like, was, a game changer for me.
Yeah.
And
I mean, exactly like you said, there's so many things to learn, so many ways to do it that it's like, you should never feel limited. You should never feel like, oh man, like I'm stuck. It's hard though. When you're in school, absolutely. Because this is all you know. You grew up, you went to school, you had summer break because you were excited to be done with school.
Right.
And then you have to go to school. And then it's around the end of high school that you're like, oh wait, there's a bunch of different ways to do this. I'm stoked. And now I'm overwhelmed with how many cool things I can do or learn or spend my time. Like that's the challenge now that I'm finding. It's like, actually my brother just put me on this book called 4,000 Weeks. Because that is the average lifespan of a person, like 77 years times 52, which doesn't sound a lot when you put it in 4,000 weeks because a week flies by like that.
Right.
And so the whole point of it is like, hey, you only have a limited amount of time here. Like cut the crap, do what you want, and like really get after it. And I was like, oh, it's true. So like I'm overwhelmed with how much cool stuff there is.
Yeah.
So it's like now it's like, hey, what is it that you really like? And again, that's the secret. It's like just if you know what you really like, you're not going to waste your time doing other things.
For sure.
You're just going to be into it.
And I find that that's becoming like a very common thing nowadays. Like people realizing like, I don't have to get a job at Target and work there for the rest of my life. Like I could save up and go get a van and do odds and end jobs and travel the country.
Yeah,
like
exactly.
And people are doing that. And I would say for the most part, I think people are getting a little bit happier and,
100%.
Being content creators is like a new opportunity, which never existed before. And that's literally just being you and getting paid to do it eventually.
100%.
Which is very, very cool for me. I think that's going to be and it is kind of the way things are going right now. Like, especially when you look at other countries, like, you know, like China, even like, dude, social media is like huge in China. Like it is beyond, like, we cannot even fathom how large it is over there. It's so crazy. And it's just a big part of life.
It's crazy, man.
Yeah.
I mean, as the internet has so many, I guess you could say, like, things that aren't great about it. The one thing is it's a really nice equalizer. Like, anybody that has a camera and access to the internet can kind of make it.
Yeah.
It's crazy.
Well, dude, I mean, you know, there are success stories all over the world. Like, you know, even PewDiePie, dude, like that guy was a Swedish dude, like in a basement for like a long time. And now he's the biggest YouTuber content creator in the world. Like, it's amazing how things can just happen like that. 100%. And, you know, no one expected him to be the biggest content creator, but he just made his own way.
Yeah, exactly. And that's the point, man. Like, these seemingly impossible feats aren't so impossible. It takes a lot of grit, and you're not going to want to do it every day if you want to achieve something really amazing. Like, I'm sure there's days that PewDiePie is like, man, I don't really want to make a video right now. But on the flip side, like, I'm sure whenever he started, he did not think it was going to get this big, but he was just like, I'm about it. And then that's the point, man. Like, you can do what you want. You just need to put that energy into it. You know what I mean?
Definitely. And just believe in yourself.
100%.
Yeah. That's, 100%. That was the biggest thing for me, was learning how to believe in myself and kind of trust, you know, trust the process, as everyone always says.
Man, it's crazy too. Cause I was talking to a friend who just had an audition for like a gig, and, she was saying like, oh, I really hope I get it. I really hope I get it. And I realized, like, in my response to her, that I was like, the process of you getting to success, the reason why it's long is because you need to not to her. I'm not saying you to her, but just to like a general you. You need to mature and develop the virtues to handle success.
Absolutely.
So if you nail your first audition as an actor, you're not ready for that. Like, you don't have the maturity and your skills and all those things. That's why a lot of these people, like, I almost feel like the universe is like, hey, you need to struggle a little bit because you need to mature up so that when you do reach success, it's like, you're ready for it.
Yeah, and you can handle all the BS that comes with it.
Correct.
Like, child actors are the best example of that, dude.
Absolutely.
Like, all the child actors who got, you know, megastar famous, like Macaulay Culkin and Miley Cyrus. Like, dude, they had really, I don't know how Macaulay's doing, but I don't think well.
I don't know. He was on the Joe Rogan podcast a while ago.
Oh, that's right. Yeah, no, maybe he's doing better, but you know, obviously I hope the best for both of them. But you know, it's just hard to prepare yourself for a world like that if you don't go through 100%. The process.
100%. I mean, like, that's kind of one of the beautiful things about jiu-jitsu, right? It's like, by the time you get to being a black belt, you're pretty seasoned, and you've been beaten down enough times too that you hold a level of maturity about you. You know what I mean? And it's like, because there is guys that come in that are freak athletes and they're studs and whatever, they're young and cocky, but there's someone that's going to smash them. And by the time you, like, are ready for your success, you're not just ready physically, but like spiritually. Like, you've matured, you've learned patience, you've learned assertiveness, you've learned all those things to make you a better person. And that's the funny thing about life. It's like, it takes grit, but the journey, the process is what's going to make you successful. Yeah,
definitely. Yeah. Absolutely. I totally agree with that. I kind of wanted to learn a little bit more about what it is to be a physical therapist. And if you could give me a little bit of insight into your practice and kind of like how you do it and what you do or what a day looks like.
Absolutely. So physical therapy, the thing we always say is we're like movement experts, right? So our job is to identify how people move and if there's any barriers into the way they move so that they're not either optimizing, meaning they're putting too much stress on their joints, their muscles, or if you're like, hey, I want to be able to move better, you know, like how we can do it, right? So the big term is we're the movement experts, right? And then we'll use whether it's like exercise therapy or manual therapy, so that's hands-on skills, like, you know, moving joints and massage and types of things, or education to help people achieve those things, right? So there's different specialties of physical therapy. The most common one that people think of is orthopedics. Orthopedics meaning muscles, you know, joints, bones, you know, so that's usually dealing with pain, like back pain, shoulder pain, after people have surgery, things like that. It's kind of expanding. So there's like cardiopulmonary health. So it's usually people that have had heart attacks or people that are high risk for cardiopulmonary stuff, like making sure they exercise in safe parameters. There's neuro. So that's dealing with people that have like nervous system dysfunction. So that can be something congenital that they're born with, or like, hey, you had a spinal cord injury. And either we're going to, depending on, you know, the severity of your injury, like we're going to get you stronger, or we're going to teach you how to do things with what you have.
Yeah.
Right. There's pediatrics, so kids. So that could be kids that are, again, born with neurological stuff, or, some kids that are just like, a little, have difficulty with coordination with certain, motions, or lacking strength or stuff like that. There's geriatrics, so elderly patients. There's sports, which is like a newer thing. So there's a lot of fields, which is really cool. I specialize, or I'm getting a specialty certification in orthopedics. So I'm currently about to finish a residency program, which I've heard the numbers, and don't quote me on this, but I've heard it's like less than 1% of physical therapists do this. Unlike medical doctors, residency is optional for physical therapists.
Wow.
So yeah, now all the physical therapists in America are doctor of physical therapy. Like about 10 years ago, almost all the graduate schools changed. Before that was a master's, before that was a bachelor's. Physical therapy is a really new profession. I think the American Physical Therapy Association just celebrated their 100th year anniversary. I think it started, if I'm not mistaken, around one of the world wars, when a lot of people coming home with amputations, and nurses were basically training people how to now move and function with their amputations or whatever. And obviously from then it has expanded to a lot more. We still deal with people that have amputations, but again, like my practice is more orthopedics. So I'm usually either helping people that have pain identify what's going on and what we can do to adjust it, or some people just want to move better, have more flexibility and strength because they're a golfer and they want their swing to be cleaner or whatever it is. So I'm doing that specialty in orthopedics. I'll finish that in a couple months, and I'm more or less growing my own practice. And my specialty, because of my background in stunts, martial arts, all these things, is I really work with athletes who are either have pain, have injuries, or are just trying to get guidance on how to achieve their goals.
Yeah.
That's kind of my wheelhouse, because one of the beautiful things about a physical therapy is you're someone's guide on their journey, right? It can be their journey from recovery from an injury or their journey towards meeting their goal, right? And so I love that, because it's like, hey, whatever your journey is, it's your journey. I'm here to help you. And because of my background, I really connect with people that are very motivated.
And your experience too, like in all the things that you've done, surfing and martial arts and stunt, like that gives you a unique perspective as a physical therapist. I think it's really interesting when you see doctors who, especially sports doctors who don't play sports or who have never played sports. It's like, it's very weird to kind of hear things from somebody who's not a part of that world, but also
I agree.
Working in that field. It's very interesting to me, but I think that gives you an edge, so to speak.
I think so. I mean, I always, obviously there's research and stuff out there too, but I almost feel like you should take the medicine that you're prescribing to people. Obviously, if you're a doctor and, you don't have quote unquote hypertension, doesn't mean you should just take beta blockers because you give it to someone, right? But at the same time, it's like, for someone like me, it's nice that when people are going through something, that I can look at them and be like, yeah, I had surgery on my arm. I know exactly what you're going through. Like, this is par for the course. It's okay. And not just to say that, but like truly be like, no, I know what you need and are going through. Because one of my gripes with physical therapy too is like, a lot of times providers are giving people just like a general list of a cookie cutter list of exercises, an hour of exercises. And you're like, would you do that? Like, hey, no, be honest. Would you do it? And they're like, oh yeah, no, I would. I go, no, you wouldn't.
Yeah. You
don't even work out 30 minutes.
Right.
And your body feels great. So you telling me when you're in pain and you're tired and miserable, you're going to do an hour of this, like putting your hand against the wall? You're not. So like, I think that's the beautiful thing about being an athlete and still being a stunt performer. Like, I know everyone's different, but I have a pretty good glimpse of like what it is to be a consumer too, not just the provider.
Well, and you've gotten to be around a lot of other athletes who, you get to learn that experience from of, like, oh, I think I have an idea of who this guy might be. He kind of reminds me of this person.
Correct.
Maybe he's not going to want to do that level of, whatever it is.
Yeah.
Just being around people more, I think is also another thing that'll put you ahead. And I commend you for going and doing what you're doing. It's, really amazing. And I think PTs are definitely underrated in my opinion, especially because you guys, like, it's not like you show up for a visit and say, yep, your arm's broken or whatever, and then, they leave. It's like your job is incredibly personal. Like when I was seeing PT for my pec tear, I was in 3 days out of the week.
Yeah.
You know what I mean? And it's like, the fact that you guys do that and it's really amazing to me. I think it's a very personal job. Yeah, no, it's wild. I mean, that's actually one of the reasons why I liked PT. I was debating between being an MD, like a doctor, or a doctor of physical therapy. One of the things I like about physical therapy is I get so much time with my patients, and not to discredit doctors. It's just the way the model is, right? Like, I get it.
they need to get people in and move on. With what I do, the nice thing is because, like in my private practice, my sessions are an hour. So we get to not only talk about your goals and work, but like there's elements of psychology too. And pain is one of those weird things that like will really mess with someone's mind, and can start these like vicious cycles. And then your mind can then make more pain and all these things. So it's cool because I get to spend time with someone and really be like, dive into that person as a whole instead of just like, hey, all right, it's broken. I'm going to send you a referral to orthopedics and all that stuff, which is necessary. Again, not to diminish doctors. I'm just saying like, that's the beauty of physical therapy. We get to spend time and really get at it. I do think they're underutilized, but again, because it's such a new field,
right?
I mean, and you even know, even in medicine, what's been around for forever, things change like every 5 years. The research is like brand new, and I'm sure we're going to talk about some new age things, right? That like the general medical community is not behind yet, and then in 5 years, it's going to be everyone's doing it. Like even simple things like. Now I was talking to a friend who's an MD, and I had a little skin infection from jiu-jitsu, nothing serious, just like an ingrown hair. Mm-hmm. And I was like, hey, do I need to put alcohol antibiotics? Like, oh no, we don't do antibiotics anymore. You just clean it, drain it with water. And I was like, what? And he's like 5 years ago, that would have not been the case. The thing with PT, it's like, it's going through that crazy research evolution, and then it's only 100 years old. Mm-hmm. So there's such a different level of care. I mean, some of the providers you get today have their bachelor's in physical therapy. Some of them have their doctorate. And not to say like a doctorate is more valuable than the bachelor's, but it just goes to show you that like within the span of one working generation, we have bachelor's, master's, and doctorate level education. And the crazy thing is like most often the best provider is someone who's like a couple years out because they have enough practice to like have their skills solidified, but they're also up to date with the most current research. Because usually it's a lot of the older providers that are still putting a hot pack on you, which is like an ultrasound, which is like kind of most of the time is outdated. Like very rarely do you need it.
I was going to kind of ask you about ultrasounds too, but what I wanted to say before is like, that's one of the things that I really like about you personally is that your approach to things is like very, I don't want to say nonchalant because that's not true, but you're very fearless when it comes to, telling people about stuff. Like when I'm like, hey bro, like I messed up my knee or I tore my meniscus, and you're just like, dude, no worries. Like we'll get it done. Things heal. Yeah. And I think that approach and to speak on the psychological aspect of healing and injuries and stuff, I think your approach to that is really, really excellent. And I think it's definitely very valuable.
Yeah. I appreciate it. I mean, that's one of the beautiful things about my residency training is like the better you are at kind of knowing the problem becomes so much less, because a lot of times it's not the problem, it's the fear of what it is, right? Because pain is scary, but pain is not correlated with how much damage you have. It's your body's measure of risk. And like the classic example is like, if you pinch your hand right now, it's going to hurt. But as soon as you let go, there's nothing wrong with it. You didn't structurally damage anything. What your body's saying is, hey, Shayan, if you keep pinching this, you might bruise yourself. You might cause a little bit of damage. Your body's going to tell you pain before damage, right? Mm-hmm. And so it's really smart with that. But then when people don't know what's happening and they're scared, well, guess what? Their nervous system is ramped up. And because of that, now they have more pain. And then the fear of what's going on almost drives more pain. And then so now they're feeling more pain, so it becomes more serious, which is more scary, and it's a vicious cycle. Mm-hmm. And so one of the beautiful things about having, a resident trained clinician like myself, or soon to be, fully completed with that, is we're really good at being like, hey, this is exactly what's going on. There's these rules and algorithms that say like, hey, you have a 93% chance that meniscus is torn, or you don't. And then also like we're really good at knowing the tissue healing timeline. So I can just look at you and be like, hey man, yeah, you probably did tear your meniscus, but it's okay because that 1/3 of that meniscus gets great blood supply. Yeah. So no worries. And then just that alone tells you like, oh, okay, like we're going to be good. And then my job is to say, hey, like this is how long it's going to take. And this is how we can maximize that time too. Yeah. And I agree. I mean, I think the beautiful thing again about physical therapy is most often than not, it's not an emergency. Right. But we're also trained in how to say, no, dude, you need to go to the hospital right now, or you need to go see a doctor. So yeah.
That's interesting. So you were talking about ultrasounds. Mm-hmm. What was the thought process behind them, and why do some people still use them?
Yeah. So as far as I know, an ultrasound machine basically has a crystal in the head, right? And then there's basically it creates like a thermal agent, like a heating agent. And the idea is it makes the tissue, a muscle, a little bit more extensible, so more pliable, right? And there was probably some good initial research or some great marketing. I don't know the origins of it. As far as I know, there's research that supports two conditions in which ultrasound is favorable. One is called calcific tendinitis, which is when your tendon gets little calcium deposits. And ultrasound can be favorable, but you have to do it very regularly for large doses of time to really get some benefit out of it. The second is carpal tunnel syndrome. I don't even know the effectiveness of those, right? But all I know is it's really those two cases. Now, the reason why a lot of people still do it is because insurance companies still reimburse a really good amount for it. And that's, again, another one of the challenges with PT. Like in my practice, at my own private practice, I just do cash because I don't want to be limited by what the insurance companies want to do. And I want you to just come see me as soon as possible. Because a lot of times if you do go the insurance model, which again, there's nothing wrong with it, it's just different, different flavors. You have to then first go to your primary care doctor, which depending on how busy they can be, can take up to 2 months. And then they have to then write a prescription. And they might even say, you know what, I want you to get an x-ray first. I want you to go see orthopedics first. And again, no disrespect to primary care doctors. They're amazing, but they don't get as much training in musculoskeletal conditions as I do.
Right.
So it's nice when you can just come to me and I can tell you, hey, yeah, this does look like a meniscus tear, but it's okay. I don't think you need an orthopedic referral. Or, oh, no, your knee is locking and catching. Hey, let's go send you to orthopedics.
Yeah.
Or, hey, no, this is an emergency situation. You need to go to the hospital right now. Like I'm trained in that. So, I think ultrasound, a lot of it nowadays just stems from people getting money from insurance companies.
That makes a lot of sense. And that's kind of one of the interesting things about how medicine can be used.
Yeah.
It can also be, like you said, marketing. It can also be used for profit. It can be used for a lot of different things. And I think one of the other points that you touched on that was really important was the fact that doctors say like, oh, I need you to go get this first before I do this or anything. Yeah. And that's one of the reasons I really respect the model that you're kind of going with, the non-insurance model. And it's because there's a lot of barriers to treating things actually, which is really weird to me. It's like, don't you want to treat this guy as fast as possible? Why the hell do I have to get 2 x-rays before I'm certified to get an MRI?
Correct.
And then my insurance might not even cover that. And then I need an MRI to get a CT.
Yes.
So it's like, why do I need, like, for those who don't know, you need x-rays in order to get an MRI. And in order to get a CT scan, you need an MRI. Yeah. And that's the model generally with most insurance companies. Yeah. My mom works for one, so she's filled me in on that.
Yeah. And so the really interesting thing too is with images. So we're talking x-rays, MRI, CT scan. With a lot of times with pain, there's actually a downside to going and get that image, because here's why. They start noticing, they did a study on 30-year-old males that had no back pain whatsoever. They found that 4 out of 10 of 30-year-old males, so we're talking healthy young people with no pain whatsoever, had a bulging disc in their spine. Now, if you tell someone that has back pain already that you have a bulging disc in their spine, now their brain goes, I'm broken. And then they live this, it's almost like you manifest it, because now you say, I'm broken. So then you go, what's the point in doing these exercises? My back is going to be messed up. So then you don't do exercise. So your muscles get weak. So now your muscles get weak. You're putting more stress on those joints and your disc. So your disc hurts more. So then you go, I really am broken. I have so much pain. And it becomes this vicious cycle, this self-fulfilling prophecy. So now actually in physical therapy, that's why we have these algorithms that tell us when you really need to go get an image, because that diagnosis, knowing that for sure, will impact your prognosis, right? Yeah. A lot of times, like the MCL and the LCL in the knee, famous ligaments that get hurt, get really good blood supply. So if someone has a grade 2 sprain of their MCL versus a grade 1 sprain of their MCL, it does little to nothing for me, except if they go and they find out that their meniscus has a little irritation, they're going to go, oh, I have bad knees now. And I can't tell you how many people I've treated that the first word they come up to me is like, I say, hey, what can I help you with? And they go, well, I just have a bad back. I go, really? You have a bad back? And they go, yeah, it's just been bad my whole life. And I go, but they goes, oh, but the doctor couldn't find anything. And I'm like, so why, what? Like, why do you have this bad back? Oh, well, a so-and-so, a doctor, a chiropractor, someone told me I have a bad spine. And it's like, huh, okay. And then like, literally then it becomes this like little game for me. It's like,
a psychological game.
Yeah. So what I have to now do is show them like, I'm going to run you through some tests and I'm going to show you do not have a bad back. And that's the thing is like, the problem with these images sometimes is if you look hard enough for something, you'll find it. And so again, like you can be a healthy man walking around with with a herniated disc. And guess what? Disc herniations heal on themselves sometimes. Meniscus can heal on itself based on the level of the lesion. So that, again, that's a really nice thing about getting a high level physical therapist is a lot of times I tell people you don't need to get an image to protect them. Not because I'm trying to even save them time or money, because I know that, hey, what we're dealing with, the source of your pain, based on these tests I've done, there's a 98% chance that you have a rotator cuff strain. Well, the rotator cuff strain can heal itself, but you might go and then find out you have some arthritis in your shoulder. And to be honest, it's not a big deal. But because the doctor told you have your arthritis, and honestly, MDs are amazing, but they're not very good with their words sometimes. And they'll be like, you have the shoulder of an 80-year-old person for someone who's 40.
I've heard that before.
So then they're like, oh, my shoulder's fucked, dude. Like I have a bad shoulder. I should never surf or swim or pull ups. And it's like, no. Pause.
That cycle.
Pause. Arthritis is wear and tear. It's going to happen to everybody. Stop. Let's not jump to conclusions. Sometimes it needs to be addressed. Absolutely. But again, sometimes you look too hard, you find something, and it's just a vicious cycle.
Right. Well, and fortunately now, like with arthritis specifically, there's so many different things that treat arthritis now. Like, you can talk medication or you can talk supplementation. Yeah. Just depends on your philosophy.
Exercise. Yeah.
Exercise too. Yeah. That's another thing that, is underrated. But, for the people who are not really interested in that, there's other means to potentially, fix yourself if you're worried about that.
Correct.
But the other thing that I wanted to say was I think sometimes I totally agree with you that imaging can definitely be psychologically damaging for some individuals.
Yeah, absolutely.
I think it just depends on how you handle the situation.
Absolutely.
Like personally for me, I find that sometimes clarity can be very helpful.
Absolutely.
And, like understanding, because I don't know the algorithms that you know for one. So it's a little bit different for me to try to understand an injury I have. And getting an image, like especially for my pec or for my meniscus, like once I got my meniscus imaged with the MRI, I was like, oh, we're good. Like I'll heal. It was just like you said, outer third, like you're probably good. No need to worry about it. Give it, 6 weeks, you'll probably be fine.
Yeah.
And sure enough, I'm fine. Yeah. I was taking nitric oxide precursors and all kinds of stuff and doing the sauna like twice a day if I could to kind of open up the highway and get some blood flow going in there and also deal with inflammation because sauna is great for inflammation too. And that was honestly, dude, I talked to my ortho about that recovery protocol and he's very interested in using nitric oxide precursors to potentially speed up the healing of injuries.
I mean, at the end of the day, right, injury recovery all has to do with vascularity.
Yes.
Right. And so getting blood supply. I mean, that's what the whole reason the outer third of the meniscus is better outcomes is because it gets better blood supply, right? So anywhere in your body that gets good blood supply has a really good chance of healing because it's getting nutrients delivered to it and all that stuff. And it's wild, man. I mean, like how much is available out there to enhance that and how little we know, and how much is coming to the forefront. But I mean, like you said, clarity is huge. I absolutely agree. And I think that's why in my practice, I make sure to, if someone is having pain, I make sure to ask like, hey, are you coming to me because you want to know what's going on or because you want to have some guidance, as to exercise or what are you coming for? And most often than not, if people are having pain, they want to know what's going on. It's the fear of the unknown that's causing more, right? And so I'm not opposed to images at all, especially if someone wants it, because if it's going to give you that clarity, I always just give people a talk beforehand.
Absolutely.
I say, hey, listen, this is most likely what they're going to find. This is what I know about this thing. And I'm just going to let you know, they might find some other things in there too. That doesn't mean that's why you're having this pain. And that doesn't mean you have a bad joint or whatever it is that you're getting imaged. So a lot of times, I'm not against imaging. Again, I have these like kind of set rules and algorithms to say when you should go get it. But the thing too, that a lot of times is give people like a prep talk.
Well, it depends on the person entirely, like it's not everyone's going to deal with stuff the same way. And it's like most people who aren't trained to read MRIs or anything like that, when they look at something, like a little bit of arthritis, they're like, oh my God, it looks so it looks scary. Like, but I think that talk is really important, regardless of if they get imaging or not. Like, hey, you could have some other stuff going on, but don't worry about it. It doesn't mean anything. Like in general, that's a good talk to have with people.
No, it's man, what the crazy thing I'm learning too is how much of our recovery, our health and wellness has to do with our beliefs about ourselves too. Not to say that it's all like the secret and you just need to like think certain ways. Like, no, there's physical stuff going on, but a lot of this too has to do with these belief models we have about our body, about what we're doing. I mean, like the placebo effect is a really real thing. I mean, they actually did a study on hotel workers that they had two groups and all they did with one of the groups was just tell them that the stuff they're doing for work is good for them. And the other group, they didn't say anything. The people that heard that the things they're doing already at work are good for them, their health metrics improved at 6 months. Their blood pressure was lower. There's all these positive things just because they believed what they were doing is good for them. The other group was doing the exact same thing. They just weren't told that it was good for them.
Yeah.
So a lot of this has to do with belief and things like that too. So again, clarity can be very helpful because if you know what's happening, oh, I do have a meniscus tear on the outer third, but it's going to get blood supply. It's going to heal. I'm going to do these things, nitric oxide supplementation, saunas, inflammation recovery. I'm going to heal. Not only are those things physically good for you, but also this psychological effect that you know that you're taking care of yourself is going to help you heal.
Yeah. And I mean, saunas especially, dude, like
Correct.
Regardless of how you look at it, I think there was I always love looking at studies and stuff.
Yeah,
and I think 4 to 5 times a week with 20 minutes at 180 degrees showed improvements in basically, again, every health metric, especially on depression, which is really crazy.
I haven't seen that on depression. That's amazing. I know the big one was, and I think Dr. Rhonda Patrick has kind of brought this to the light for everyone, is that it was like, 4 to 5 times a week it was 19 to 20 minutes. Decreased people's all-cause mortality. So any reason that you would die that's not accidental, meaning getting hit by a car, or gunshot, or something like that, like long-term, by 40%, not 14. Like that's crazy.
It's insane. There's no drug that does that. And I don't know, are you familiar with, I think it's Dr. Peter Attia?
Yeah.
Yeah. Did you see that podcast he did with Rogan recently?
Not recently, but I know of him. Yeah.
Incredible. So they talked about VO2 max, like elite athlete level VO2 max has a 5 or 6 times reduction in all cause mortality.
Yeah.
5 or 6 times. That is insane. And, if you who knows what happens when you do saunas with that? Like, you don't know how much the human life can really be extended. It's
crazy.
It's amazing. And just health overall. Like, I think the fact that, fields like yours are, getting more mature and, more research is being put into them. I think the advancements in medicine in the next 20 to 30 years are going to be amazing.
Yeah. Huge.
Yeah.
I always laugh too, because I always think like, what we're doing right now, we're going to look back in 50 years and think that we were barbaric.
Absolutely.
Because if you think about like, the Civil War, they would just do amputations without cleaning the tools. Like they didn't have things back then. I'd be like, it's going to be like 50 years from like, wow, we did radiation therapy, chemotherapy. Like that was crazy. I can't believe we used to do that to people. Like, and it is like, we're working with the best that we have right now, of course. Right. Like, no disrespect to anyone that's doing that. But it's amazing to know that, probably in like antibiotics are like being phased out. And we're like, you're using antibiotics? Like obviously they're still there. People need them sometimes. But it's crazy how like we're just thinking like, oh my God, in 10 years, we're going to look back at what we're doing now and be like, this is nuts. Yeah.
Well, and dude, I mean, even like putting screws in people's hands, like it's like crazy how, we think like, oh, this is what you have to do now, bro. And then like, 10 years, it could be totally like, frowned upon or whatever. Yeah. And the antibiotic thing I think is really interesting too, because there was it was like an anecdotal report out of, I think it was like Venezuela, where they did probiotic supplementation, like high quality probiotic supplementation, and how it actually reduced the illness symptoms that you had, which is crazy. Like, you think like, I need antibiotics to kill whatever I have. And it's like, dude, maybe probiotics could support the good gut flora. And then that really regulates your immune system. Like
amazing.
People don't really know, but gut flora is super important for regulating 100%. The immune system,
your mental health.
Yeah.
And the funny thing too, is your cravings. Like people always talk about, like, how do I stop eating junk food? I'm like, we'll put good food in you and you won't crave it. And they're like, it also goes physically too, because the way I always tell people is like, your gut flora is like the population, the nation. And they're having an election all the time to say, hey, what should we eat? Because your gut flora will talk to your brain and be like, we like this, we don't like that. And obviously there's psychology and stuff too. But from the physical side, if you have good bacteria in there that feeds on fiber, right, prebiotics, well, then in order to survive, they're going to tell your brain, hey, let's get more salads in here. Let's get whatever it is. But if you have bad bacteria that only feeds on refined and processed sugars, right, then it's going to say, hey, let's get some cheesecake in us because that's what we need to survive.
We're going to die. Yeah.
We're going to die if we don't.
Yeah.
So it's like if we have more good bacteria in our gut, well, then it's going to tell our brain more often that we want healthier foods to feed us than if we have bad bacteria.
Absolutely.
So I always tell people like, hey, you want to like, curb your cravings for junk food, go have like kimchi and like kefir and these probiotic things, because you get some good bacteria in there and then you supplement it with just a little bit of fiber. Like your brain's going to be like, it's going to have like a sway in the vote and the demographic being like, we need to feed this now.
Well, and potentially like, increases in performance. Like
Correct.
and that's one of the things that I found really interesting was when I did, obviously people talk about keto and how it's great for the brain and, you get rid of brain fog, but you don't really know until you do it. Like it is insane. Have you ever done a ketogenic diet?
I haven't done a ketogenic diet, no.
It's really insane. Like there's no joke when people talk about like, some of the bowel distress that you get from it. That's like really important and you should pay attention to that. But, like, dude, when I was cycling, like my performance metrics went up by like 15 to 20% in my HIIT interval sessions.
Wow.
15 to 20%.
That's pretty
And
wild.
you don't expect like a power increase, but I was also doing kind of some interesting, like electrolyte stuff and making sure I had enough glycogen. Like I had a really, really specific diet, and there was one day out of the week, it was on a Friday, where I would cut off and eat like apples and like, just like some weird fruits and some electrolyte mix that I would make. And dude, I mean, the power was insane. And in combination with the clarity of mind, like I was able to get so much done. I was so productive.
Yes.
But it's not sustainable no matter how you look at it.
Yeah, I mean, sure. I think the big takeaway for me from this too is also just to be like, look, there's things out there that can greatly enhance the quality of your life. And you don't have to look very far, right? There's obviously new age supplementation. Like I'm all for it, like trying new things and breaking new barriers. But even simple things like cleaning the way you eat can make your performance better by 15 to 20%. And probably for someone who's not already cycling like a maniac will get even more benefit, right? Because already if you're at that level, like to get a little bit more is much harder.
Yeah, you're eking out the 1%.
Exactly.
Yeah.
So it's like, but just to show people like, hey man, just like a little thing can greatly improve your day. Like meditation, what's that famous podcast? Like 10% happier or whatever it is. It's like Sam Harris.
Oh, the Sam Harris podcast.
Yeah, like they talk about like just like 10 minutes a day can make you like this much happier just because you're present. And it's like, man, that's why I love my job, because I can provide someone a little piece of information that they can then take and then like, boom, go with it. And your life is, you can't measure how much better it is because it's a ripple effect, right? It's like if you're in a little less pain or you can move a little better, then you're going to go exercise more, because you exercise more, you're going to sleep better, because you sleep better, you have more energy the next day. You don't have cravings. And because that, you're more likely to exercise even more.
And handle stress better. It's compounding interest. That's really what's amazing about it.
It can either be a vicious cycle or it can be compounding interest and get momentum, and you can just, so it's like,
that's what's amazing about medicine, dude. And the fact that there's people going in all these different directions and
100%.
And they're all eventually going to converge at one point.
Correct.
And then there's going to be like a parameter style or like a bunch of algorithms that you can run through and improve your life.
Absolutely.
Depending on where you're from, obviously diet plays a huge role in your genetics. So it's always important to pay attention to.
Yeah.
What do you have any success stories that like mean a lot to you? Like, do you have any clients that you worked with that made you super happy, the outcome? Or is it just working with people in general that makes you really happy?
Yeah, I can't think of anyone on the top of my head that like particularly I'm like, oh, that was really awesome. Because everyone kind of gets something different from it, and there's not like a specific one that sticks out to me. I think the things that always stick out to me are like the connections with people, and also like the resilience that certain people have. And yeah, I mean, I'm still amazed by how awesome the human body is and can recover. And yeah, like there's not one specific one like, oh, I fixed this person's blah, blah, blah. Because again, everyone has the inherent capacity to fix themselves. I'm the guide along the journey. So I don't take too much credit, honestly, because at the end of the day, like I'm going to give you the tools and I'm going to consult, and I'm also going to, if I need to get my hands in there and work on you, like I'm going to do it. But like, it's really up to you.
Yeah.
I will say there are a lot of times where I have people that have this narrative of having a bad something, or they've had pain for 10, 20 years, or they can't imagine being able to do this thing because they've lived this way for so long. And I've looked at them and I'll be like, no, we're doing that today. And they're like, what? And I'm like, yeah. Like we're doing that today. Mm-hmm. And so there's not like a specific one, but it happens more often than not. Like just because people are, again, they have these narratives, and to be fair, like if you're not a physical therapist, you're not someone who spends your time geeking out about this stuff. Like you don't really know what's possible and what's out there.
Yeah.
But yeah,
that's interesting that'd be a cool position to be in, to kind of break that narrative and watch and see that. So yeah, I could totally see where you're coming from. That I'm sure that happens a lot, and I'm sure that's great.
Yeah,
and really rewarding.
It was actually this week. I had someone who was seeing me in my residency program, and was like a young female, like very young, younger than me, and was like, "Oh, I have bad knees, bad hips." I always start the session with how can I help you, right? Because that's ultimately what matters. Like, what do you need? Because like I said, everyone wants something different. And she goes, "Well, I have bad knees, bad hips, bad ankles, and a bad back." Person's like roughly 23.
Wow.
And I was like, "Okay, can you elaborate? What do you mean by that?" And they go, "I don't know. Just like my chiropractor when I was young said I had bad ankles." And I was like, "Well, why do you have bad ankles?" And she's like, "I don't know. That's what they said." And so this girl hasn't been exercising for her adult life because she was scared that she has bad joints that are going to get ruined. Now, she does not have any autoimmune inflammatory disease. She does not have anything systemically that's like wrong with her. So I presume that the chiropractor said it was something mechanical, like, "Oh, whatever he or she came up with."
Yeah.
And so I was like, "All right, well, let's look at this." So I looked at her hip, I looked at her knees, I looked at her back, I looked at her ankles, full range of motion. Some muscles were weak here and there, but nothing that was like abnormal beyond what most people walk around with. And I looked at her and I was like, that thought that you have of these bad joints and all these things, like you need to like take that thought and throw it in a river of fire.
Right.
And like, I basically showed her, I was like, "No, look, like you can lift your knee up this much. Like I can crank on your knee. I pushed on your back. I did all these things. You can squat, lift, all these things. You don't have bad anything. You just need to go exercise. You're going to get stronger over time and things are going to get better." Mm-hmm. And she was like, really like, "Whoa, this is crazy." Cause she's walked around with this narrative for her whole life, like since a kid. I was like, "This is nuts."
Yeah.
But yeah, so like the moments like that are really cool.
I bet. Yeah.
I'm just like, yeah, you don't need to think like this.
Yeah. Well, that's just like a whole nother level of rewarding. I mean, you literally probably changed that person's life.
I hope so.
Yeah. Well, regardless, they have the information to make that change. It comes down to the person at the end of the day. And that's that's another really interesting thing about medicine is like you can have somebody who has a problem and you're like, "Here's how you fix it," and they're just like, that's always really interesting to me.
Yeah, and that's why I really like to work with like motivated high level athletes because it's like I say, if you say jump, they say how high, right? And oftentimes I have to rein them in versus like some of my other patients and other settings where it's like, I'm like, "Hey, I need you to do this every day." And I try to make things as simple as possible because I know most people are busy, whether you're a professional athlete or not. Doing an hour of different exercises really isn't going to stick with you. I really reserve that for people that are like post-surgical because it's like, "Hey, you're not on work right now and we can do as much as we can. Like this is going to help keep you busy."
Yeah.
But for most people, I keep things really simple. Like we're going to work on one or two things and nail this. Like I want this to be bulletproof so we can move on to the next level. And, like I'll give like one exercise to someone and they're kind of not really an athlete and they just don't even do it. I'm like, I could not make this more simple for you. Like I figured out how to do it at work. Like you don't need any equipment, but then you get an athlete and I'm like, I often have to be like, no. I just want you to do this like for 30 seconds. You don't need to hold this stretch for 6 minutes. Like let's, it's an interesting thing. Yeah.
Well, that's funny. How you want to work with athletes and stuff. Like that's my ideal practice. Like when I end up going through medical school, whatever avenue I pick. I mean, I'm a bio major right now, so but yeah, whatever avenue I end up picking, I want to work with athletes. I want to have a practice specifically dedicated to athletes, and I just think that there are people who want to make the change, and they want to get better, and there's nothing more rewarding than making someone as good as they can be. And dude, that could potentially win a gold medal at the Olympics. Like you never know what metric, you can improve.
Absolutely.
But it could be seriously substantial.
Yeah. And the other thing that's really nice too, is like a lot of times it's the 1% that often will then permeate into the rest of society, right? It's like, we always start with something that NASA or the military does. Mm-hmm. It works out really well. Then it kind of comes to the general public because it's like, oh, they have this need to do these things at the highest level. Mm-hmm. So it's like, oh, okay. So then they develop this technology and then they realize that technology could be really applied to other things. And I feel the same way about athletes. It's like a lot of times the health and fitness trends first start with them because they're willing to do anything it takes to get that little bit of edge, to do whatever it is, to do what they love. And then we find out, oh, intermittent fasting is actually really great for everyone. Oh, actually this supplementation is really good for everyone. Sauna use is good for everyone. Right. Yeah. And a lot of times it starts with them as the forefront and pioneers of like, the health and wellness journey.
Yeah, and definitely. And I think one point to mention too is that can also be somewhat misleading because there are lots of athletes who BS. Like,
Correct.
Like, I don't really want to use The Rock as the example because everyone's, beat that dead horse as much as it can be. The guy's on ridiculous amounts of steroids. Like, people have caught him or whatever. So
I don't know anything about it, but I mean, I wouldn't be surprised.
Yeah.
I don't know, but yeah.
Just like actors and stuff like Chris Hemsworth after one of his roles was he looked like a skateboarder. Like he looked like a frail, thin skateboarder, and 5 or 6 months later, 20, 30 pounds of lean mass. And it's like, that's not achievable no matter who you are. Lean, like that lean, the dude was crazy lean, but
yeah, I mean, I don't know. I will say this, working in the film industry, I mean, I don't know anybody who's on it or not on it or stuff like that. That's not really my role, or I don't even really have that question unless I'm providing care for them and I think it matters to their tissue quality. But I will say the nice thing about with them in the film industry is they will use any sort of financial, like money's not an issue. So if they want to get 4 personal trainers and a chef and a massage therapist and sauna access and all these things to get their goal,
it's there.
They will get it.
Yeah.
And then a lot of times what they're actually doing is they're trying to get their body ready for this one peak moment. So like a lot of times actors will actually intentionally dehydrate themselves for like 2 or 3 days to look good for that one scene. So it is not to say that people aren't on stuff. Like that's not what I'm saying. But I will also say like a lot of times those like photo comparison moments are literally them at their best where they have like almost like UFC fighters. Like they'll go through extreme lengths to make weight.
Right. Yeah.
Which really is not their like normal. And then the other photo is usually like the worst side of them.
Right.
Or not the worst side of them, but then when they're just like caught slipping.
For sure.
But yeah, no, there's a lot of people on stuff.
Yeah, definitely. Well, I think that's also interesting too. Like the only reason I'm really familiar with that is because I wanted to get into the acting industry a long time ago. And, Henry Cavill, like he's surprisingly open about a lot of the stuff that he does, like not his hormone use, which I speculate there is some. But he talks about the dehydration and all the stuff that he does to prepare for one scene. Like in his new role, The Witcher, I don't know if you've seen it.
He's yoked.
Yeah. Well, not only is he yoked, but dude, like he dehydrated for 3 days for that bathtub scene.
Yeah.
Like the iconic Witcher bathtub scene.
Yeah.
And, he talked about it. He was on some kind of talk show. He's like, I dehydrated and, whatever. The whole point that I'm trying to get at is not to be mad that people are on steroids.
Yes. Yeah.
But it's to understand that some things may not be achievable that same way.
Correct.
And especially when you talk about some of the guys who prepare for roles and they're like, I ate chicken, broccoli, and rice. It's like, dude, there's no way you gain that much mass eating chicken, broccoli, and rice. And you can't, like, you're so nutrient deficient if that's the case, dude. Like, I don't even know how you're still functioning.
It's true.
You know what I mean? Like that's what I mean.
I agree.
Yeah. I was talking with Cam and I said, I think steroids should be allowed in the UFC mainly for recovery, not for, performance enhancement, even though that will be like a minor side effect of recovery. But, I just think it's high quality information that can pass on to people is really the important thing I was trying to get at.
I guess that with the steroids in the UFC gets some more like a philosophical debate. It's like, I don't have an opinion one way or another because nothing about what's MMA is healthy for you.
Right.
Like,
right.
But then again, I'm not, my philosophy in life is not to be the healthiest person.
Mm-hmm.
I want to live a meaningful life. And my goal as a physical therapist is to help you live your meaning. My goal as a physical therapist is not to make you a perfectly sterile body of optimal cells.
Right.
Unless that's what you want, then I'll help you get there. My goal is, hey, you love skateboarding and you want to skateboard better. Okay, then let's do that. If you want to be an MMA fighter and you want to do it better, let's do it. Like, there's nothing healthy about going out there and smashing skulls with someone.
Yeah, getting it in the head.
If that's how you love to live your life, then I'm a guide for you.
Yeah.
I will say with steroids, it's like, I just know nothing in life comes for free. And I feel like it's one of those things that's like, you're putting the turbo on, and because of that, you're probably taking from somewhere else. Now, I'm not saying you should or shouldn't do it again. My philosophy is whatever you want to do, let's find you the resources to get you there, right? So if it is, hey, you want to be the most jacked, the most ripped, and steroids work, like, man, more power to you. I think there'll probably be some consequence on the other end, which maybe we do or don't know, but yeah, no, it's interesting. It's out there, man.
Yeah.
Like it's out there and things are also getting better too. Like one of the really interesting thing about steroids is, again, it's like sometimes it's the forefront of medicine because it's people trying to get that little 1%. And so they're willing to do like something brand new And then because of that, the rest of the medical community is like, oh, that works out really great.
Yeah.
We should do that thing that we all said was not those darn kids, you know?
And sometimes it works backwards, dude. Like I was talking with Cam again about how Dianabol was originally used for grandmas who needed to gain weight. Like
Correct.
that's crazy.
Yes.
And there's all kinds of other stuff. And I think it's super interesting how that whole field can work. And to kind of touch on the there's no biological free lunch.
Yes.
That's very true.
Yes.
I think when you look at it from a heavy mass perspective, there's definitely a correlation with people who are heavier than they should be having shorter lifespans, especially when they're abusing hormones and stuff like that. It's a fact. Like you see these bodybuilders dying every week, and it's really unfortunate. But I do think when you kind of control the mass and you stick to a mass that's good for you, if you're using steroids for recovery, I don't really think there's that much of a sacrifice, especially when you consider the fact that, like, let's say the dude might have torn his ACL.
Yeah.
And he's on steroids, and guess what? It repaired super fast. So he didn't end up getting that injury and having that other deleterious outcome.
Yeah.
And who knows how much that saved him on his psychological life. You know what I mean? Like, I do agree, though, that there is definitely, there needs to be some looking into that for sure.
Yeah, I guess. And that's the interesting thing is, like, because steroids inherently are anabolic, right? Yeah. So it's about building tissue up. And I think a lot of times the issue with life, right, or our bodies is we're always trying to maintain homeostasis. Like when you go to PT school, medical school, biology, it's like homeostasis. That's like the golden ticket, right? Which is about balance. And so, yeah, we need anabolic pathways that help build us. But if we have too much anabolic stuff and not enough catabolic, like that's where things might get out of whack. Or maybe because you have a supplemented anabolic phase, then when it gets to catabolic phase, either your body, this is theory again, I don't have research to back this. Maybe your body has to go through more catabolicness to like bring balance, or it doesn't now know how to do anabolic without the use of, exogenous substances.
And that's a big problem for guys who get on TRT, and especially like kids my age, 19, who go on steroid cycles, like with Tren, and then they're like, my testes aren't making testosterone anymore. And it's like, that's definitely something, to consider.
Yeah. And again, it goes back to whatever your philosophy in life is. Like, I think they did a study on, again, I don't know the numbers off the top of my head, but they did a study on Olympic athletes, and they basically said, like, you'd be guaranteed a gold medal, but you have to take a supplement that would kill you 5 years after you get that gold medal. Yeah. And it was some like ridiculous number, like 80%. Again, I'm paraphrasing this.
No, yeah, Cam said the same thing, dude. We
something
talked about
like that. Like 80% of them would say yes. So it goes then, okay, 5 years is not a lot of time. Right. That's crazy. And considering most Olympic athletes are like what? Let's say in their like early 20s, right? So it's like they're basically only having 5, so they'd be 30. Let's say they're 25. I'll even give them the benefit of the doubt. So they only have a sixth of their life left after that, right? And so it's like, all right, if that's your philosophy, I'm not here to change your philosophy on life, right? But then you just know, like, these people are willing to do what it takes to put it all on the line for this one thing, even if it means the rest of their life vanishes. Yeah. And to each is their own. Like, there's people for that. Like, I personally am not at that level of commitment to something like that. But again, I'm not here to tell someone not to be. It's very commendable that you're willing to put that much of your life in it for that. But definitely, it's out there. I mean, people are willing to do whatever it takes. Yeah. It's pretty amazing. Yeah, it is. It is really amazing. And just to see the dedication of certain individuals, it's really like, it's amazing how much people put their bodies through. Yeah. And I'm very longevity focused in mind. Like whenever I tell people about, peptides or whatever, I'm like, if you're going to do this, I want you to be on it for as little as you possibly can. Yeah. Like, and I want to talk about exit strategies. Every drug, everything, every ounce of intervention that you add, I think there should be an exit strategy spoken about. Correct. And I think, that kind of comes back to steroids too, is if you're going to do steroids, you need an intelligent way to leave your cycle so that you can actually restore, catabolic function. It's very important. Like, whether that's clomiphene or, some of the other, hormones that, kickstart the rest of your endocrine system working normally again. There's all kinds of stuff that you can do for that. And I think that should be talked about for basically every treatment. Absolutely. I mean, I can't speak on steroids obviously because I haven't done the research on that, and that's one of the things I'm like, if I don't know my thing as a medical provider, like I don't want, because I don't want people doing that for physical therapy, right? Like I'd hate it if someone's like, you just need to do this exercise, and it's like, no, I'll let you do your thing, you let me do mine. But that's one of the reasons I love PT is because I think that like that biological free lunch, the consequences of what we do are very minimal. Like often and not, it's like, hey, I'm trying to restore muscle balance to you. And the price that you have to pay is time and energy, like dedication.
And maybe some discomfort.
And maybe a little discomfort.
Yeah.
But it's not like I'm going to give you this pill that is going to be good for you now, but F's up your liver down the road, or like this thing that you're going to be dependent on. It's like, no. What we're doing is just creating new habits in the way you move. So you're paying it up front, and it's also like very minimal. I'm basically helping your body do that homeostasis. What your body's naturally supposed to do is heal itself and move and play and run and do these things. Like I'm just going to help it get to there with very little sort of consequence for it, other than time, energy, a little discomfort. Sometimes, and I don't even really think it needs to be all that discomforting sometimes.
Definitely not. Yeah, PTs in my opinion are like the biological anti-loan sharks. You're like the low interest or no interest loan. You know what I mean? Like
I love that.
It's there's a new thing.
We're an index fund.
yeah, absolutely, definitely. And dude, if you're interested in hormones and stuff, I have thousands of papers I can send you.
Yeah, no, I love learning as much as I can. Yeah.
I have 2 terabytes worth of
I can't wait till you go to medical school.
Oh,
you're
dude,
gonna be a teacher's like favorite student and worst nightmare, because they're gonna be like, oh, I love how interested in it, and then you're also gonna be like, hey, professor, because I was that kid at school, because I was getting mad, like, man, we're just talking about like some of these really basic things, like I got it. So like me and my friends in the back would like literally, if like the teacher was reviewing something that we're like down with, like all right, we just like turn our iPad on and we're like looking up new things or talking about stuff. And I remember I was known as like, to the teachers, the kid that would ask questions that like had very little to do with the material, because in my mind I was like, yeah, I got it. You said that, like, let's go on. Like, I'm ready. Do you know anything about this? And sometimes they would take it as like a dig, where I'm like, hey, professor, like, what do you know about this? And I'm not saying like, what do you know about this? I'd have to like do this long thing. Like, hey, if you know anything about it, I'm just really curious. What are your thoughts on this? Like, I know some people do it, some people don't. Yeah. And some of them would still take it like, oh, this youngin's trying to flex on me. I'm right. Like, no, I'm not. Right. I'm here. I want to just learn.
Dude,
like,
yeah, definitely. I get that a lot too.
Med school's gonna be fun for you.
Oh, dude. I'm looking forward to it, but at the same time, I'm dreading it. Because I'm sure you've even noticed, like when I approach you and ask about certain things, I'm like kind of backwards in how I ask sometimes. And it's mainly because I don't want to offend anyone. It's not even because like, it's just what I'm used to, you know, like I go and talk to doctors all the time, and, you know, I'm going to have some on the podcast and I have to ask questions a certain way, because otherwise they're offended and they don't want to talk to me. Yeah.
And I think like, I mean, I'll say this. I think anyone who's offended is insecure. Yeah. And they're trying to hide their insecurities by trying to shut you down. Because if they don't have the logic or the rationale behind your question, or how to either say, yeah, your question's valid or it's wrong, then they need to use another mean. So they need to use bullying to be like, that's a dumb idea. Why would you say that? When it's like, no, if I know exactly what's going on, I can calmly say this. Just like we talked about, like how I was nonchalant about your knee. Like, I know what's going on. So there's no need to panic. Like, or like you like, yeah, tell me what you need. Oh yeah. Okay. This is what it is. I totally agree with you. Or I don't, you know what I mean? But it's people that are insecure that have to shout, yell, bully, belittle people because they don't have the other means to deal with the situation. Right. It's like, like, and that's a thing too. It's like, I think if you're insecure or like you're like arguing with people about medicine, it's like, man, you really don't know like how little we know in the scheme of things. Like, I get why people get upset, because on a global scale, misinformation can be damaging, right? And we don't want to promote something that is going to set people back, especially when there's so many providers that are trying to move forward. But on the flip side too, like on a small scale, if it's like, hey, I'm just asking you a quick question, and it's like, you're going to get mad at me for it. It's like, yeah, what's going on here? Like, we're just trying to, you know, help everyone get better. Yeah. And I think the people who take offense to things don't like science, because science is always about, you know, debating and talking and open discussion. Correct. And I think, you know, like even when I ask you about certain things and you're just like, well, here are my thoughts on that. And I'm like, interesting, here are my thoughts. And then that's how it's supposed to be done. Yes, you know what I mean? Exactly. Like that's exactly how things are supposed to go. And I think it's really interesting that, you know, you are able to put yourself in that position and, you know, be receptive and open and listening and you know, thinking, not even just listening, but thinking through. And that's something I wish a lot of doctors would consider a little bit more. Yeah. I'd say for the most part, they're pretty good. Yeah. You know, I see really great providers, but I've definitely, and I'm not even joking, I've walked out of doctors' offices because I'm like, this guy,
or, you know, this girl or whoever, I'm just like, I'm not into how they do things.
Yeah, I will say like it is, as much as like I give respect to a lot of doctors and I don't know the situation that they're in. Like I'm a doctor of physical therapy. I'm not an MD. And I know some of them have gone through tons of training, so much school and all this stuff, and they must be exhausted. And then someone comes to them with their own requests and they're like, oh, I'm just trying to do my job. Doesn't matter. There are still some bad providers out there. There's bad physical therapists out there. Like that's the real nature of things. In every job, there's people who are really good at what they do and there's people who are not good at what they do. And that's okay. But at the same time, when it's my body, and I'm sure everyone likes the same way, when it's your body, you want someone who's like good at it. So I don't think there's anything wrong with like having your own opinion about certain things or even seeking second opinions, because I've seen people almost get surgeries they didn't need until they either saw me or another. Even I had them go see another orthopedic doctor because I was like, listen, this is going to got a lot of scar tissue. You're going to go through like 6 months of recovery to only get where you're a little bit. And yeah, like one of my success stories that before I was even PT school. This is pretty funny because I wasn't even in PT school yet. I read this book from an orthopedic surgeon who talks about the benefits of hanging, meaning just hanging from a bar for your shoulder.
Right.
And one of our friends from Jiu Jitsu was about to go get rotator cuff surgery. I wasn't even a physical therapist yet. I just said, hey, I heard about this thing. You might just want to try it. Like it's just hanging from a bar. Right. And to this day, he always goes, I owe you lunch. He goes, you saved my life. Like you saved my shoulder. It was going to be like a $70,000 surgery with recovery, like all these things, his insurance and blah, blah, blah. And this and that. And he goes, I hung from a bar for 1 minute. And then after that, I could raise my arm up all the way. And my shoulder still bothers me from time to time, but then I just go hang and it feels better. And I was like, yo, my man, like that's crazy. That was before I got into PT school. So I was like, oh, I'm fully into this now.
That's super cool.
But yeah, like you said, like there are doctors out there that don't have great information. There's a lot of really amazing ones.
Absolutely.
So I'm not discrediting them as a general, but I'm just saying, hey, like if it's not an emergency, you can afford time for a second opinion. You can afford time for some other things, your own research, like do it.
Yeah. And when I talk to people about like quality of care, that's like one of my big focuses is making sure people get quality care.
Absolutely.
I always say, go get another opinion.
Absolutely.
Go look online and see top providers, you know, look at board certified or look 100%. At whatever, go see this guy, go see that guy, you know, if you have the time and if you have the means to do so.
Absolutely.
And, you know, do you have any recommendations specifically on how to like make sure you get good quality of care other than you know?
So I'll speak for physical therapy. So a couple things one is, usually there are some studies that show that people have these specialty certifications or residency trained have better outcomes. So if you can find someone who's residency trained is one. If you can see someone that has for orthopedics, we have the orthopedic clinical specialist. So it should say like it will say on mine, hopefully in the future, Shayan Safar, PT, DPT for Doctor of Physical Therapies, OCS. I don't have that title yet, but I should in a few months if everything goes well.
You will.
Thank you. So yeah, if you have someone who's an OCS certified or there's SCS for sports, that's always a good sign because that means they've passed another board exam or they've done a residency. I think also with physical therapy, the nice thing too is a lot of these things are an emergency. So you have the time to be like, hey, I'm going to go try with this person or I'm going to go shop around. It's hard because PT is one of those things, again, that has elements of, you know, physiology, psychology, all these things. So also it's different strokes for different folks. Like some people may not like my style because I can be very cerebral about certain things. I can be very simple about certain things. And instead they want an hour of, you know, this exercise and they just want me to like, just tell them like without any consultation and things like that. So you do have to find your own style. I think for quality of care, getting someone who is specialty certified or who has done residency training is huge. Personally, I think it's crazy because I'm in this residency trained world and I see so many providers. I mean, even after residency, there's fellowship, which is another thing. And then we have people that have done multiple of them. I also teach part-time at my grad school and I see like other people that are teaching. So you can tell that there's some people that just do it from 9 to 5 and they just want to show up and get their check. And there's other people that are like, I'm going to do this thing right. And that's how I felt. Like,
and just being interested in, you know, what's 100%. Out there.
Yeah.
Yeah.
With doctors, it's harder. I couldn't tell you like how to find the best doctor. It's funny. One of my cousins, who's one of my role models in life, he just, he's a urologist and he did a fellowship in urological oncology. And it was like, this really prestigious fellowship. So he's like considered to be one of the best urologists in the nation right now. And even him and I sometimes talk about like, oh yeah, like it's really interesting to see the different level of care. He's not even speaking about his own colleagues, but just like, yeah, there's levels into medical care. You know, there's some people who really almost don't seem to care. And there's some people who really love what they do.
I think it's just like everything, like every profession, you know, kind of like you were saying, there's good and there's bad. And, you know, one of my focuses is not to give medical advice, by the way, I should mention that right now, but it's to give people the information to make the best decisions they can make for their recovery, well-being, you know, stuff like that. That's always really important to me. That was a really good answer. I wanted to ask you about knees specifically because knees terrify the shit out of me.
What is it that terrifies you about them?
Well, just like, you know, torn ACL or, you know, whatever injuries like that. Like, could you kind of speak on like maybe someone who's going through them, like what to expect and even how to strengthen them or like if there are things you can do?
Yeah. So I will answer those questions, but let me ask you this. What is a worst possible scenario that could happen to your knee?
I mean, I don't know. I ask myself that question. It's really just the fear of the unknown. Like, I don't know. Like, you see guys like Kamaru Usman who have totally trashed knees. Like he talks about it and he's, you know, number one.
Yeah.
So
there you go.
Right. But, you know, just to kind of ease the psychological aspect of it.
I think John Danaher, I don't know if he has a knee replacement or a hip replacement, but he has a joint replacement and has one of the most intelligent jiu-jitsu minds of all time. Knees in general, I think, get a bad rap because based on the sports we do, they tend to get pounded a lot. So the thing that's really interesting about a knee is in theory, it has 2 degrees of motion. It can just bend and straighten versus a shoulder that it's like a ball and socket joint. So it has a lot more rotation and angles. Your knee just bends and straightens. It has a little bit of rotation, but that's not the primary thing. The knee, I always tell people, is where the hip and the ankle meet, right? And it's like the elbow of the lower body. They have the similar mechanics like that. The reason knees get often messed up a lot is because they're only supposed to bend and straighten. And a lot of the things that we do have forces that don't just go straight. So ACL, MCL, a lot of those things happen when someone's foot is planted and they have a force going one way and their ankle's going the other way, right? And it's not supposed to do that. So that is often why it gets beat up. The other thing too is we do tend to be on our bodies, on our feet all day. So they're the ones that are taking the pressure, right? So if you're a runner, if you're overweight, you're doing all these things, your knees are taking some pounding, right? And it's just like, it's almost inevitable because of how much we're walking or standing, things like that, or we should be walking or standing. The beautiful thing about knees is besides like the inner third of the meniscus, it gets great blood supply. And the ligaments that are most often injured, your MCL, your LCL, even your ACL, gets some pretty good vascularity. And now they're even showing that ACLs really don't need to be repaired. There's a whole group of people in the research called copers, and they're basically people that don't get ACL repairs. So a lot of times they do a study where they get like 30 people that have ACL tears, and they have 15 of them that want to get surgery immediately, and then 15 that are opting out to basically saying, hey, we'll do 6 weeks of physical therapy, and then at the end of it, if you still want to get surgery, it's there for you. If not, no worries. So they just delay it. The beautiful thing is, even if they end up getting the surgery at the end of the 6 weeks, their outcomes are much better because they've gone through a strengthening phase. They've gotten some of the pain down, the fear about things going on. Some people's ACLs either don't need it, and they've even seen in some MRIs, it actually will kind of reform and sort of get like thick, like some scar tissue there. So ACL is a really big, scary one. And to be honest, it's not the scariest thing out there. Right? Honestly, most things in the knee are not too scary. The worst is if you have a meniscus tear that's on the inner third that's catching and locking. That might require surgery. The nice thing is there's really 2 meniscus surgeries. There's a meniscectomy, which just means they remove a little piece of it. You can literally run the next day if you get a meniscectomy. There's no contraindication after. There's meniscal repair. And because they're repairing that tissue, they want to protect it. Because meniscectomy, they just took a chunk out. So there's nothing to be careful about. Like, oh, it's gone. You don't have that problem thing in your body anymore. Meniscal repair, the idea is, hey, we're trying to save some of your meniscus so you have a little bit more because your meniscus is like a brake pad in your knee that will, over time, can wear out. So if you get a meniscal repair, it just means you have to be like you're on crutches for 4 weeks and then like in a brace. But again, it's not like terrible. If your lifestyle can afford it, it's okay. maybe some more trouble things are like knee arthritis. That usually happens to people who are overweight and or very weak, like muscularly weak. And the reason is because if your muscles are not doing the work, your joints are going to do the work, right? So usually people that have really weak quads, really weak glutes, or calves tend to be the people that are very overweight. And if you think about overweight, just means now they're carrying more weight, so their muscles have to be stronger to keep up with that. There's nothing inherently wrong about being overweight itself, but unless your muscles can keep up with it. Now, most people that are overweight don't have this amount of quad and glute strength and all that stuff to support that weight.
Right.
But they did a study, and it was like for every 1 pound of extra weight you're carrying, it multiplies by, I think, anywhere from 4 to 12 pounds on the knees. Now, all the other ligaments, MCL, LCL, unless you avulse it off the bone. So there's different kinds of tears, right? It's a ligament like this. So if it tears down the middle, it has the opportunity of kind of like reattaching. Avulsing means it's like you tore it off the bone.
Right.
So it's still in one piece. It's just not attached to the end. And in that case, that warrants surgery. I mean, because you can't really, it won't just naturally attach on. Who knows? Maybe in 10 years they'll find.
Got to pin it for now, though.
Yeah, pin it or whatever. For now, you basically tack it down. I believe, don't want to quote me on this. I believe that's what happened to Tony Ferguson. Because he had an LCL tear and he got surgery. Now, because he's a high level athlete, the surgeon might also just been like, hey, you know what? Like, we want to preserve everything with you. But unless it's avulsed off the bone, that's why you usually need surgery.
Yeah.
Both the LCL, MCL get really good blood supply. ACL, you don't need to repair, or often sometimes it can heal itself. Meniscus, depending on where it is, gets really good blood supply. There's a ligament in the back called the PCL. PCL, honestly, you could not have. I know many people that don't have it and they fully function.
Wow.
Are fine. So that's all the ligaments. Your joint, meniscus, and then arthritis. Usually for young people, arthritis is an issue. And again, if you're really strong, arthritis really isn't that debilitating. I don't want to say that. Maybe I misspoke when I say debilitating, because I'm sure there's plenty of people out there that are suffering with it. So
it can be, yeah.
It can be. But I will say if you get strong, it can minimize the effects of it and you can still function. Now,
absolutely.
And the worst case scenario too is you get a joint replacement, and they're so good at that nowadays that it is a recovery, but you can still do many amazing things.
Yeah, they are fairly impressive now.
Yeah, so I don't think you should be scared about knees. Now,
okay.
No one likes getting hurt. Now,
right.
I'm not saying like, if anyone who tore their ACL, like, just toughen up. But like, man, nothing. They're so good at some of this stuff now, and like ACL surgeries have advanced so much too. Like now they do double bundles with like different grafts and things like that. That it's like, yeah, don't be terrified of knees as a leg lock enthusiast.
I know. Yeah. For everyone who doesn't know, this guy is a leg lock specialist. He's terrifying, but you're very ginger about how you apply. He doesn't even apply pressure. I don't want people to think he's a murderer. Yeah, definitely. But yeah, no, that's interesting. I think the thing that freaks me out about knees, I was thinking about it a little bit while you were talking. The thing that freaks me out a little bit is being unstable. So
that's usually a ligament thing.
Yeah.
The nice thing is muscles give stability too.
Yes.
So if, in theory, even if you tore a ligament and it feels unstable, if you get your muscles stronger, you'll get that stability back.
Yeah. That was the thing that actually freaked me out about the meniscus the most was like, I had some weird, like, it wasn't anything in particular, but sometimes it would just feel like unstable. Like it was very strange.
And sometimes it's not even the structure that's causing the instability. It's the inflammation and pain that will sometimes make your muscles want to be quiet because it's scared. And then your body's like, oh, no. So then your muscles kind of shut off. And because of that, now you're kind of walking around like on like wobbly legs.
Yeah.
Really, everything structurally is okay. But inflammation and pain a lot of times inhibit muscles. And muscles are there to stabilize. And so, yeah.
It's interesting you say that too, because when I would work out on it or when I would get it kind of going and probably release, some level of adrenaline, it would probably cope with the inflammation a little bit, you know, just based off of, oxygenation and all the other stuff. And it would go away. Like when I was working on it, would be fine. It's just like when I would get up from sitting at my desk, I'd be like, whoa. Exactly. Like it would feel really weird. So yeah, that's a good breakdown of knees. I think, that's pretty good.
Yeah.
Shoulders too. Shoulders are a big one. So could you kind of...
Yeah. So shoulder is actually pretty complex because there's like 17, 18 muscles that all have to work in play. That's just muscles, right? Then we're talking about ligaments, joints, and then the referral. It can refer from sometimes pain from there. It can refer from your heart. It can refer from your gallbladder. So shoulders can refer from the spine a lot of times too. Like it can actually be radiculopathy that you don't have neck pain. You just have shoulder pain. So shoulders are a little bit more complex in terms of diagnosing exactly the tissue source, what's going on. Hey, is this a rotator cuff strain? Is this biceps tendonitis? Is this cervical radiculopathy? Is there something inherently wrong with the joint? And again, shoulder gets really good blood supply, right? Rotator cuffs get good blood supply. Rotator cuff tears sometimes don't need to be operated on. Again, a lot of people walk around asymptomatically, especially elderly people that have full function of their shoulders, but have rotator cuff tears. So nothing too worrisome. It's a very mobile joint, which is a beautiful thing. It can reach back and do all these things. The problem is there's so many things in the shoulder that have a lot of nerve attachment, which means it's very sensitive to pain. That's why I think sometimes it's scary. A lot of the things in the shoulder get really good blood supply and they'll even heal on themselves. It's just because it's so nerve sensitive, it can be painful. The one thing that I love in my practice when I have someone that has shoulder pain is ruling in or ruling out cervical radiculopathy, because a lot of times you just get shoulder pain, but really it's referring from the spine. People go to a physical therapist for months, get no relief, get really discouraged, think that this is a lifelong thing. I push on their neck and they get reproduction of their shoulder symptoms. And I look at them and I go, is it really interesting that when I pressed on your neck, not your shoulder, you felt your shoulder pain. If I pulled your neck up and unweighted it, your shoulder pain went away. I didn't touch your shoulder. And they go, yeah, it's referring from my neck. And I go, and so I treat the neck, 2 visits, they're good.
Wow.
Something like that. Like everyone's different. It's not always 2 visits. But so that's the interesting thing with shoulders, just because there's so many nerves that run along it and there's so many muscles. It needs to work like this beautiful symphony, because even just raising your arm, it's not just your shoulder joint, your scapula needs to move properly, or shoulder blade.
Right.
If the 2 of them don't move in alignment, you get impingement. If your spine is flexed, like if I kind of round, I can only raise my shoulder up there. If I sit up nice and tall, I get full, 180 degrees of range of motion.
Yeah.
So shoulder's just more complex as a clinician to diagnose and all the impairments, but again, great blood supply to most things. So not super concerning if you know what you're dealing with. If you're ruling out heart and lungs and like referral of a possible tumor, and again, we have these kind of questions to know, is that a high likelihood? Do we need to worry about that? If that's not the case, it's like, all right, let's just figure out exactly what's going on. And unless you're like a young person with like a bad rotator cuff tear, fracture, muscle tear, it's like, it's pretty benign. We're going to treat it. If you're a young person with some muscle tears, like we should probably go get that surgically. Yeah. A consult for that.
Yeah, definitely. I think one of the interesting applications for shoulders is actually peptides. Like there's a guy who goes to our gym who was interested in peptides for his shoulder impingement. Yeah. And he had done PT and he had done all kinds of stuff, and it didn't really work for him. And I told him, I was like, maybe you should go see another PT. And he was like, I will, but I just want to, I was interested in hearing you talk about peptides. I looked at the risks myself. I associated that it's not really going to be that big of a problem. Let me try, a 2-week cycle. And I was like, all right, here's a potential place where you might be able to get them. They're pharmaceutical grade. He ended up trying them for 2 weeks. The shoulder impingement was gone after the 3rd day. And he was able to do things like tricep dips. Now, to everyone listening, I wouldn't ever recommend doing that, especially for something so simple like a shoulder impingement. Yeah. Maybe not simple, but you know what I mean? It's benign relatively. Yeah. But he actually had really great success with peptides, and I'm sure even on like a muscular level, it did some really interesting repair. I don't know if you're familiar with any of the studies on BPC or TB500 or...
Not off the top of my head, no.
Yeah, they're really interesting. I'm definitely giving you paperwork on that.
Great, I'm going to have more homework now.
Well, it's good to know, and I mean, to understand, obviously you can't really, tell people go and do it because it's not FDA approved and, all kinds of other reasons why. But
learning as much as you can is always... makes you a better provider.
Yeah. And I mean, being someone who's in the know, so to speak, and having talked to endocrinologists and some doctors who are, actively exploring these different kinds of treatment, they are a firm believer, the ones that I've spoken to, that it is just a matter of time, that they are just dialing in dosage to then, run through trials. Interesting. Which, for most peptides, obviously there's like thousands of different peptides that you can, inject and stuff. But the ones I'm speaking on specifically are TB500 and BPC 157. All right. They're really incredible. And I'm actually, again, I'm not giving medical advice, but I'm doing I have to make that disclaimer.
Yeah, no, of course.
But I'm actually going to be doing peptides for my wrist. Okay. I'm doing PRP. And I have to get an MRI first, and we're not doing the PRP because we don't want to see a bunch of fluid. So I'm doing PRP, and after my MRI, and I'm also going to be injecting BPC into my abdomen, 500 micrograms twice a day. And it's it's really annoying to have to reconstitute and inject peptides twice a day. Twice a day. Yeah, twice a day. And some people even think 3 times a day is ideal. Yeah, but there are oral versions of the peptides that, theoretically work just as well. Like, some people, there's conflicting evidence on that, but for the most part, they seem to be equally as bioavailable.
Interesting.
But it's just the skipping of first pass, like through the metabolization process, in which you actually develop the better metabolites for healing, supposedly. This is what just people believe. So,
makes sense.
there's different ways of going at it. I'm going nuclear because nuclear? Oh, I'm going nuclear, bro.
You wouldn't do it any other way.
No, we're in RBMK1 right now. One
of the things I love about you is, like, even when we did that shoot, you were like, no, we're going to do this. Like, you got like the drone, the thing.
Oh yeah.
If you do something, like, you're going full nuclear.
Dude, absolutely. This is straight up Chernobyl zone, dude. We're going nuclear, dude. So yeah.
Oh, that's awesome.
But that's like, especially for my scaphoid fracture, which is, what I have. It's a non-union, it's a waist fracture.
Yes.
3 months out, which is not great. I'm looking at a very small chance of a union. And the surgery, from what I've looked at, from all the people I've consulted, I've consulted some of the best wrist specialists in this area, and even the greater Los Angeles area. They've all been like, yeah, bro, the surgery's kind of messed up, especially if you're young and you're an athlete. So they were like, not like I wouldn't recommend it, but if you want to explore other options and you feel like you would be disappointed if you didn't, do it now.
Hey man, this might be that thing that sends you on a different trajectory and makes you like a game-changing figure in the medical community.
And
so
that's what I hope. All the data that I've looked at, there's a lot of osteogenic effects of BPC 157. And, I'll, like I said, I'm giving you all the paperwork on that. But there was a study where they took a bunch of rabbits and they all had a genetic bone deformity. And they injected them with a equivalent to body mass, 500 microgram, detail for a human, twice a day. And it repaired the genetic defect within this muscle tissue, which was insane.
That's pretty wild.
Yeah. And it's also, people are actually looking at them for cancer. Like people are looking at specific peptides because they are immunopeptides. They affect your stomach. They come from stomach bacteria. They're looking at applications of this potentially against cancer. So cool. Yeah, it's really amazing. Cool. Like there's
Medicine's wild.
Well, absolutely. And dude, there's peptides for hair loss. There's, tricopper peptides is one that people applied directly to the scalp and it supposedly combats hair loss. I don't really believe that, but like, I use them. I just, they're cheap and I want to make sure I'm, addressing everything from a hair loss perspective. And, there's also like,
man, what are you talking about? Look at those locks. What do you need to worry about?
Dude, I noticed I started to have some diffuse thinning a little bit. Dude, I'm telling you, bro. I'm telling you, I had a little bit of crowning, and that's normal when you get to age 18.
If you're Middle Eastern, you get that at like 12.
Yeah, that
this is
can
all
happen.
Special effects people.
Especially, we have 3 makeup artists outside, but no, fortunately though, as with many things, hair loss is now a choice. Like there's
it's crazy.
There's definitely things that you can do now, and I'm looking at, for me specifically, I don't want to take finasteride. Not that finasteride's bad, ladies and gentlemen who are listening. Finasteride's an amazing drug. It even prevents prostate cancer in men, which is also really great. That's actually one of the reasons it was designed. Yeah. So, it's a really interesting drug. I'm just looking at like topical SARMs. Like we were talking about steroids and how steroids are really incredible. SARMs, selective androgen receptor modulators, for those who don't know, there are SARMs for hair loss that bind specifically to the androgen receptor. And I mentioned this in the last episode. It's called RU58841. There's also some other ones like CBO301, which is another one that's really cool, which is also an acne medication. Floridil, I think, is the clinical drug name. But yeah, they bind to the androgen receptor, and the problem is that the dose has to be really, really, really high because the binding affinity is relatively low.
I see.
So for those who don't understand binding affinity, it's basically just like the ability of something to bind to a specific
how likely
receptor.
It's going to hit the target.
Right, and and that's usually equated to based off of like molecular weight and things like that.
Polarity, all these things.
Right. And it's RU has a really low binding affinity. It actually binds to testosterone a lot better than it binds to DHT, which is the primary cause of hair loss among men. And, you have to get a really high dose to make it work, but it does. And I think that, in the future, there are going to be specific designer-made SARMs to bind to DHT that can be topically applied that hopefully won't go systemic. And that's ideal. Obviously, not having a medication that goes systemic that solves your problems.
And that's the dream, right? I mean, that's the thing with PRP. It's like PRP in theory is really amazing because it reinstitutes a new inflammatory cascade without actually doing tissue damage, right? Because inflammation gets this bad rap because we talk about chronic inflammation all the time, right? Because essentially inflammation is the beginning of the healing process. It's your body's way of recognizing and saying, hey, we have a problem here, right? And so it then, if you have this inflammatory process, your body then wants to clean it up. And that's when it sends all those nutrients and things to say, hey, like, we have something going on. We have the vascularity, the blood supply to heal it. Let's go do it. So now all these new age techniques like PRP are about reinstilling a new inflammatory process. I mean, now you even see people doing like what they call like micro needling for hairs.
I do that for my head.
Right? Because the idea is you're causing a small little abrasion in the skin. It's going to then cause more blood supply to that area. Blood supply improves hair growth, whatever it is. So the problem with PRP is blood is so systemic. It's like, how do you keep it in that area, right? Because what you're doing is you're taking someone's blood out, you're centrifuging it, so it's a high dose of platelets, right? The platelets are one of the things that are in that inflammatory process that say, hey, we have a problem here, right? Platelets are famous because if you cut yourself, that's the thing that kind of creates a scab.
Right.
Right. So anytime there's an inflammatory process, you have platelets. The platelets are then telling your body, hey, Brandon, we need to go clean this stuff up. We need to go fix it. We need to repair it. I think the challenge with PRP is, hey, how do we make sure it stays local to that area and that PRP just doesn't hit some blood vessel that then just the platelets circulate everywhere. And then, we're not really doing anything. We're just re-injecting stuff back into the blood. So it's really interesting. It reminds me of what you're talking about, like the affinity and the dosage and making sure it's specific. Like these techniques are really awesome. And I think we're just learning how to refine them so that they really, really work. Yeah. Right. Like I think PRP is one of my favorite things because it's literally your own body. So there's like very little to no side effects. And it's just us basically tricking our body to say, hey, this is a brand new injury, right? Let's treat it like so. Because a lot of times what happens is if you have an injury and whether it's vascularity or whether it's your lifestyle, you don't fully recover from it. And then your body after a certain amount of time just kind of accepts what it is as it is, right? So, and some of that could also be psychological, right? Because anytime we have pain more than, I think the research shows anytime there's pain more than 6 months, your nervous system receptors actually get more sensitive to that pain and you can kind of train it otherwise. But if you kind of are just living in this pain cycle, your body then becomes more sensitive to pain. So again, it becomes that vicious cycle like we talked about, right? Right. But if let's say someone doesn't fully recover because the tissue hasn't healed 100%, the idea with PRP is you're then doing a new inflammatory process in that area, but you're not damaging that tissue, right? So you're not tearing that ligament more. You're just putting more signal there to your body to say, hey, something's going on there. That's all it is. And then because of that, your body's like, whoa, like sends a ton of blood supply to that area. And I think that's so cool. That's just like so wild.
And to kind of speak on the localization effects of PRP and I think how to best utilize them, I think, it's mainly good for areas with low blood flow to begin with. Correct. And I think, when people are like, let me just inject my pec with, PRP, it's like, I don't really know how I think it kind of depends on the area in my opinion from what I've looked at.
I'm sure. Yeah. It would make sense.
And especially because like if you're getting low blood supply or whatever and your body forgets I think that eventually PRP is going to be a cycle. And let's say you have a chronic injury, like a non-union fracture, you're probably going to get 4 to 5 doses of PRP. Yeah. That's my guess. I think it could also
make sense. Yeah,
definitely. And I think it'd be really interesting to kind of explore that, like in the spinal realm. Like that would be really interesting to see if we can, fix certain things like in people's spines that could be chronic and all kinds of stuff like that. I think, PR, like I said, like you just said, PRP is like my favorite thing right now. It's really interesting and it's like the best, like cheapest form of biological hacking.
Correct.
And it has the lowest side effect profile.
Correct. Like that biological free lunch, right? It's your own body.
Yeah.
Right. It's just, so, I mean, obviously time will tell whether there is some long-term, I don't know, effect of it, but theoretically it seems very minimal because really what you're doing is just temporarily reducing your red blood cell account.
Yep.
You're just taking that out. And then, people donate blood all the time. People lose blood all the time.
And you're not introducing new metabolites of other drugs. And, there are no scary half-lives that you have to worry about. Exactly. So that's the kind of promise for PRP. And that's why I think it's really interesting and why I'm trying to develop a protocol for a scaphoid fracture. And if it works, I'm going to be really stoked because like obviously I don't want to have to go get the surgery.
Get published before you even go to med school.
Well, just an anecdotal report, and I'm pretty particular about how I do stuff. So I'm making sure that I monitor, like I'm going to make sure I inject at the same time,
correct,
every day, for the times that I'm injecting and kind of catalog the time duration that I have PRP, like, once every 2 months, once every month, just see how it works.
No, it's important that you're specific and clean about that because otherwise you really don't know what is causing the change.
Yeah. And I mean, either way, like if someone totally external is looking at it, they're like, we can't trust this guy. We don't even know who he is. But at least
it's for you at the end of the day, right?
At least it's organized too. And at least I know what works and kind of, theoretically how to look back on that in the future if I end up getting any kind of, research degree or whatever. That would be really good for me.
Nice, man. I'm excited.
I'm excited too, man. I really hope it works.
Me too.
And to kind of touch on how to avoid injuries, how do you avoid injuries?
Man, that's tough. I'll say this. I mean, what I do is inherently high risk, right? Like in stunts, there's like an adage that's not like if you get injured, it's when something serious happens.
Same with motocross.
Yeah, jiu-jitsu, surfing, all these things. Like you're doing things that maybe the human body's not supposed to do.
Right.
So like at some point you're gonna run into something. I don't know if preventing is possible, but I will say that reducing the chance is anytime you have a movement deficit, let's say you're lacking flexibility, your body's going to make up for it somewhere else. So like if your hips are really stiff, your spine is going to make up the slack and your spine's not supposed to make it. Same thing with muscle weakness. If you're weak somewhere, your body's still going to get the job done. It's just going to compensate by using something else that may not have the ability to tolerate that biomechanical load over and over and over again. And so my thing with injury prevention is making sure I have adequate mobility and adequate strength. So I think in general, like increasing my muscle strength, increasing my flexibility and my coordination of certain things will reduce the likelihood of injury or the severity of it.
That's really interesting. I don't know if you're familiar with this study, but it came out of Canada. I think University of Calgary.
Has to be good.
I think University of Calgary. I think they were doing a study on football players, American football players, who do eye coordination and foot coordination, hand-eye coordination as well, training before the season started. They were 60% less likely to get injured.
That's huge.
60. That's
huge.
So crazy.
That's crazy.
Yeah, and they didn't
believe it.
They didn't specifically. You can question the quality of the study for sure, but and they didn't really say everything that they did. But I think that's really interesting how to potentially incorporate that. Like when I was younger, I did an athletic program with Chris Thomas. He's a former NFL player. The guy was insane. He's like the craziest athlete I've ever met.
Dude, NFL guys are specimens.
Well, what's really interesting about him is he was also super smart. Like he wasn't like, just like, go to the gym, bench press, whatever. Like I was like 7 or 8 years old when I was working with him. He had like a program up in one of the neighborhoods over here at a park. And he had these glasses that you would wear that like flickered and like made you like work with your hand-eye coordination a little bit more. It trained you a little bit better.
That like we're just finding out now is like,
yes, like this dude, I called him like a month ago or something. I was like, dude, you were onto something. It's like, cause he stopped training. He works privately with athletes now, but I was like, dude, you were doing something. Like, it definitely made me a better athlete. It's like when I did other stuff and
it makes sense.
Yeah. It's really interesting. Like how he had such a scientific approach that, then people were probably like looking at him like, what is this guy doing?
Yeah,
like,
absolutely.
Yeah, he's super brilliant though. Shout out to Chris Thomas. Guy's crazy. Okay, we are back. We had a little bit of a break. I can't remember exactly what we were talking about.
I think it was your trainer and the coordination, preventing injuries.
Yes, yeah. No, that was that. I don't know. That's such an interesting topic for me, preventing injuries, because you're kind of told how to deal with them when you get them, but not really how to prevent them. Yeah,
I mean, I think it's like a culmination of trying to create as good habits as possible. Things happen, man. Like that's the nature of thing. It's like, I mean, especially in the realm of jiu-jitsu, it's not just your body, it's someone else's body, and there's other training partners around you and things like that. And surfing, right? The ocean can just do whatever the ocean wants.
It does crazy things.
Yeah. It just is like, hey, we're just going to launch you in the air. Or like we're going to have a huge wave all of a sudden. Like things happen. So to go through life without it, or to say it's not going to happen, is kind of foolish. I think it's to say, hey, like, how can we mitigate the risk? How can we make them less severe? How can we handle them better when they're there? And I mean, I think they've done like, I've only seen one research study on like jiu-jitsu athletes and stuff like that, because I was going to do it and I was like gathering data on other studies. And one thing they found is usually smaller people tend to get hurt more, right? Because they have more mass that they're going against.
I see.
So like for me, I try and lift weights and build some more muscle strength, just so that when I'm at training, there isn't as much pressure on my joints and things like that. Or I try to make sure my flexibility is good, because certain things like your hips and shoulders should take a lot of flexibility, because other things shouldn't be getting tweaked so much, like your spine or stuff like that. But yeah, I think like if you are someone who's really passionate about a sport or something like that, it's a good idea to go to a physical therapist beforehand to get consultation about it. Because honestly, I think the future of physical therapy is, we have obviously like recovery from injury, but the beautiful thing would be if it's like a dentist model where you go to one every 6 months and they will identify like certain things and be like, hey, your tendency is to do this when you're squatting or lifting or do these things. Like, hey, let's change that so that if we nip it in the bud now, the likelihood of this being a thing later is much less. And I think the same thing with like an athlete. Like if you're a golfer, I want you to show me how you swing, even when you're not in pain, because then I can be like, oh, dude, your hips are really stiff and you're getting all this rotation from your low back. And because of that, you're just wrenching out your low back. But if I get you more hip internal rotation, more thoracic rotation, like you'll get not only less likely to get injured, but you'll get better performance. And that's a cool thing too. That's one of the things I like about working with high level athletes, is usually the things that are minimizing pain and injury are also things that make you better at your sport. Yeah,
that's very true. And I think, that's one of the reasons I started doing, like functionally specific exercises for jiu-jitsu, like making sure that I was, like squatting, but not an unreasonable amount of weight or anything like that, just to make, get some extra strength going. And, I cycle 4 to 5 times a week. That was my ideal training plan on top of doing jiu-jitsu. And, I was doing that for a while, and that definitely, I think the least injured I got was when I was cycling the most, which is really weird because I was doing other weightlifting too. But, like the more activity I kind of piled on, the less injured I got.
Yeah. And I think also if you cross train a little bit and whatever that looks like to you, I think there's a reason that surfing and jiu-jitsu pair really well, because they're almost kind of like, they have like some philosophical things about them that are very similar. Like your partner will do whatever they want, just like the ocean will do whatever they want. You have to be calm under pressure. Like if there's big set waves and you're on the inside, like you can't freak out. You just have to go through it. There's all these other things, but one of the really interesting things from a physical side is jiu-jitsu a lot of times tends to be really like closing in and curling up and like squeezing, versus surfing is really opening up. And so I think a lot of times that's why they're really good cross training, even just physically, like for your spine. Jiu-jitsu you tend to be in flexion a lot, and surfing you tend to be in extension. Yeah. So I think cross training is really important, and understanding like, hey, for as much as I do this, it's going to be good for my body to also do this to bring balance.
Yeah. That's a good philosophy. Definitely, cross training with purpose.
Correct.
That's always good to pay attention to. I kind of wanted to, speaking a little bit about jiu-jitsu, how long have you been doing jiu-jitsu?
So it was actually like June 1st of 2016. I can remember the day.
Really?
So 5.5 years. Unfortunately, because of COVID, I wasn't able to step in on the mats for 11 months. So that's when I learned leg locks, because I just bought like the BJJ Fanatics DVDs. I bought Danaher's and Lachlan Giles.
Okay.
So I studied and I drilled with someone in my garage for a little bit, not a lot, but so it's been 5.5 years. I wish I was able to continue through COVID. I would like to think that I would be much better.
I mean, it's not like you're shabby or anything, bro. I wouldn't beat yourself up over it. Like,
there's levels.
Well, your leg locks are scary, dude. That's you pull them out of nowhere, dude.
It's fun, man. I like it just because it was actually Lachlan Giles who. So for those people that don't know, there's a competition called ADCC, which is like the Olympics of jiu-jitsu, and he is actually a physical therapist in Australia. And so he entered 77 kilograms, right? Which is not light, but you're not a heavy guy in the scheme of things. And he ended up getting third place in the absolute, meaning there's no weight class restrictions, against some people that are on all sorts of steroids,
right?
And massive people. And he leg locked 3 of the heavyweights, including the heavyweight world champion that year and 2 other previous heavyweight world champions. And he leg locked them all. And
wow.
I was like, oh, this is really cool. Like you can really tap into this if you know what you're doing.
It's a powerful tool, man.
100%.
It definitely, it completely gets rid of size. Like
yeah, it can. It very much can.
Yeah. If you get in the right spot, definitely, you know,
Yeah.
and I wouldn't like, if you're in a bar fight with someone who's like 300 pounds, I don't think I'd go for a leg lock. I think I'd run first.
Yeah, 100%.
Yeah.
So, I mean, I'll say this, it's definitely not a get out of jail free card, because
Right.
even one of the critiques that people give about it is people can hit you like while you're doing leg locks. And
Yeah.
like our beloved coach Rodrigo will like fake kick me in the head if I go for one, like it has a joke.
I have video of that, dude.
Yeah. So he has points. And honestly, one of the things he told me too is he's like, if you learn leg locks too early, you get kind of hooked on them and then you forget about the rest of jiu-jitsu
Yeah.
and you get stuck. And I think sometimes my rolls are worse when I go for them, because what happens is I will give up position to try and attack the leg just because I want to see if it works. And then I end up like I was on mount and then I went for someone's leg and now I'm on the bottom and they're smashing me.
Yeah.
So, but yeah, I've been doing it for 5.5 years. I started with Rodrigo, and then because of grad school, I was still sort of training at Rodrigo's, but because I wasn't going to be able to train as much as I want, I asked him if it's okay if I kind of cross-trained at another gym at Gracie Baja. And it was a great experience. I got to train with some world champions and all these things. It was really fun. But yeah, I'm kind of back, for now in Westlake, and I'm back with Professor Rodrigo.
Yeah. Well, it's a good place to be, man.
He's amazing.
And that explains your really unique style. Like I didn't know you trained at other gyms or anything like that, but you do have a very unique style for our gym.
Yeah, I think also Rodrigo's style is very old school pressure passing. I'm a small guy.
Right.
So I never could rely on that. Like Rodrigo he's not a giant, but he's a heavier dude. And so my style is a lot less smashy and grindy, and it's a lot more like I'm constantly moving.
Yeah, I was
kinda
gonna
like
say
a mosquito, just constantly buzzing around people. Because I won't really out muscle a lot of guys in our gym, so I'm not gonna try. So instead, I will let go of grips and positions, but I'll just immediately move to the next side, or the next one.
And that's really interesting to me to like watch, because like I've rolled with you a couple of times, and just like when I make a move to like pass your guard or whatever, you're like already like you're in another dimension by then.
Yeah.
You know what I mean? Like you're very. It's interesting to roll with guys who are so focused on movement, because someone who is my size, I'm 173 pounds when I'm at my peak weight or whatever. It's very weird to get stuffed. Like when somebody just moves a little bit and it throws me off, it's like, okay, well, my pressure isn't working, or I need to improve it, or I need to do something entirely different. Yeah. It's very eye-opening to see different styles like that. And your style is very eye-opening for me to improve my game.
I think it's amazing how everyone has different styles, and that like rolling with different people make you better.
Yeah.
It's cool. And no, it's a beautiful thing about jiu-jitsu. It's
definitely.
Like, it's so wild. It's such a cool thing.
It is, yeah, dude. Like you said, levels, bro. Levels. There's different levels, and some levels look entirely different.
It's
like
crazy.
Yeah, it's really, I don't know. I love the sport so much. I mean, if I haven't made it obvious by the first 2 episodes, having lots of jiu-jitsu focus in it, like
back to back.
Well, dude, it'll be, even when I have doctors on or whatever, I'll still be talking about jiu-jitsu.
Yeah. Like, we've never done it.
Yeah. But, I think for the people listening who don't do it, there's a lot of value you can get out of it. I'm sure you can speak to that.
Yeah. I mean, it's not for everyone. I will say that. Like I think if you're curious about it, at least go try it. Yeah. And same thing, like a doctor, like go get second opinions, because I've heard many people go to a gym and they just didn't like the vibe of that gym and they rubbed it off. And then years later, they went to another one and then fell in love with it.
Yeah.
If you're curious about it, just go do it. And again, like same thing, like don't get an analysis paralysis. Just go to a gym, try it. If you love it, great. If you don't, go try another gym. Like there's usually a few in the area if you're in like a pretty, decent metropolitan city. And see what you think. And at the end of the day, worst comes to worst, if it's not for you, at least you learn something about the universe. At least you learn some self-defense, like all these things. Like it's only gonna, learn good things. I mean,
yeah.
just be careful because, depending on where you go, some gyms are a little bit more aggressive than others. Like, you always run the risk of injury when you're doing something like jiu-jitsu. I always tell people when you're new, you start off gentle and you explain to people you're new. But the other thing too is like, usually the high belts are going to match your pace. And I always tell this to newer people.
You've told me 1,000 times.
I'm going to go as hard as you go with me. And the problem is, just because when you're newer, you haven't spent as much time to refine your skills or your movements, people tend to be sloppier. And when they're sloppier, they tend to hurt someone, right? Yeah. So most of my bad injuries from jiu-jitsu have been because I've been with someone new and I've given them too much space. So now if someone is really aggressive and they're new, I'm going to shut them down.
Yeah.
Like, I'm not even going to give them space to breathe. And it's not to be an asshole. It's literally to protect their and my well-being.
Yeah. Well, it's necessary for sure.
And it's necessary. But it's even a safety issue. Like, it's not even ego. It's literally a safety issue because I've gotten my nose broke because I was being really nice to someone and they just were violent, didn't had bad intentions. Yeah. But when he tried to knee cut, he just kneed me right in the nose.
Oh.
I've had a rib popped because someone just still new, like all these things. And it's usually with people who are new.
Yeah.
So my advice to people who are just starting out is like, actually roll with the people who are more seasoned. Like, our coach actually really doesn't like it when two white belts roll together. Yeah. Because that tends to be chaos. And secondly, go in there gentle, because even if you're a big, strong guy and you want to prove something, you need to accept that you're going to get smashed. Yeah. Like, I don't care who you are. And I think I knew about jiu-jitsu growing up because when I did Taekwondo, we rented our school out to a jiu-jitsu instructor. So as a little kid, I knew about this like crazy ass art. But I was also a smaller person. So I didn't go in there being like, I'm going to fucking show everyone who's the shit.
Right.
Like, I went in there being like, I'm going to get beat up. So I'm just going to play and like learn. And because of that, people are really nice and supportive.
Yeah.
Because I mean, the nice thing about jiu-jitsu, it tends to weed out assholes, because if you're an asshole, people are going to want to smash you because you're just like being a dick. So either you don't survive and you leave, or you tend to learn to be a little more humble. It's not 100%, but for the most part, it helps with that. So most of the people in the gym are really cool and they understand how difficult it is and they want to help you. But if you're being a threat to them, like, I'm not gonna be nice if you're gonna hurt me.
Yeah,
so
definitely.
So I always tell people, it's like, hey, go roll with higher people, try different gyms, and just be gentle at the beginning. Like, go in there knowing you're going to get your ass kicked. So don't try to prove it. Yeah. Like, just try to do the moves right. And if you do that, you'll be good. And even for people that are experienced, like, my advice to people is like, you don't focus on the result. You focus on executing the moves properly. I mean, that's just life. If you put too much energy in the final outcome, the result, and not the energy in the steps it takes, then you're not going to get what you want. If you just focus on the steps it takes, then you'll get what you want. Like, I remember when I was learning tricking, which is like this martial art acrobatics I do, my coach said the reward. So everyone wants to do a backflip and it's scary. So everyone thinks about how cool would it be if I land a backflip? Oh, I don't want to get hurt. So you're thinking about results. You're not thinking about the steps you need to do, which is squat, jump with your arms extended, lean back, tuck your knees into your chest, open up. If you just think about those 4 or 5 things, you will do the backflip. And then the reward is the landing. The landing is your chocolate cake at the end of it.
Right.
But don't think about that. Just think about the steps you need to do. The landing will come. And so if you give too much energy to the result and not the steps, you're not going to get anywhere. Like, you're someone who's applying to medical school. If you just think about how sick it would be to be a doctor and all these things, but you never apply to medical school, you don't study, you don't do any of these things, well, then you're never actually going to become a doctor, because you're just spending your time ruminating about how cool it would be.
Yeah.
If instead you put no energy to that and you're like, hey, I'm just going to study things, I'm going to talk with people on a podcast about it, I'm going to do these things, you're just going to become a doctor because you've done the steps. Mm-hmm. And then you'll sit there and be like, oh yeah, I'm an MD now.
Yeah.
Like, because I did the steps necessary. I didn't spend too much time worrying about the results. Same with jiu-jitsu. People so often get worried about, oh, I lost that round, I lost that roll, I got submitted. Well, the way I get really excited about it is every time I'm rolling, I just focus on something I did right. Like, so it's like, even if it's as simple as like, I created a frame. Like, I could be going with Professor Rodrigo and he can just, I mean, the guy's so talented. He can do whatever he wants to me. Right. So if I break a grip, that's a victory. Like, I broke one grip that match. I did something right.
Yeah.
That's it. That's all it needs to be. I mean, obviously the better you get, the more you want to do right, but don't focus on winning or losing. This isn't a tournament. Focus on just doing things well, and then you'll get the result that you're looking for.
Definitely. Yeah, that's really solid advice. And you know, like coming from the white belt perspective, I should say, and I know you know because you were there at one point too, and maybe from a little bit of a bigger person because I am on the larger side, but you know, like when I started, you know, rolling with people for the first time, like, you know, Rodrigo was like telling me, he's like, don't roll for a long time. He's like, you need to like come in, drill the basics, and then go home, think about it, and then like after 30 he told me 30 classes you can come and then you can roll with people. And I was like, interesting. So that kind of set me up to kind of think a little bit more cautiously about what I was doing. I didn't, from a lot of people, and you can see it, like they come in there and they're not thinking like, oh, well, if I smash this guy, I'm going to hurt him. They're just not thinking about it. It's it does. And then they're not like, well, if I do knee on belly or whatever, and I slam on this guy, like, oh, you know, he might be out for a couple weeks. Like, you know, people don't think about that, especially white belts, you know, like, and it's again, as you know, it's not coming from a place of wanting to harm people. It's just simply because you don't know.
Yeah. Like, and I mean, exactly. You don't know. And then also it's going to be more fun for you too, because if you go in with expectations, you're setting yourself up for failure. Like you don't go in with expectations. You go in there just to learn, right? Because I'll tell you, like, if you go in there expecting it's your first day to go submit a purple belt or a brown belt or a black belt, dude, you're going to go home crying. Because if you go in aggressively, like they're going to smash you. And the harder you try and prove your point, the harder they're going to smash you. So it's like, it's not only going to keep people safe, you'll enjoy the process more.
Definitely. Yeah. Every time I've come into the class or like a Friday open mat with expectations, I usually leave disappointed.
Correct.
Even if I do what I want to do, I'm like, oh, I could have done it better. Yeah. Or, oh, you know, it didn't go the way I wanted to, or, oh, I caught it by accident. Yeah. Like, you know what I mean? Like every time I come in with expectations, I end up somewhat disappointed. And it's just, you know, like you said, it's probably not a good thing.
Yeah. No, I mean, that's life in general, right? Like
yeah.
Expectations are a lot of times can set yourself up for failure.
Definitely. Yeah. Right. Very true. What personally has jiu-jitsu done for you?
Man, I need a whole nother podcast for that.
Yeah, we're already at 2 hours, bro.
I'll say jiu-jitsu gave me a lot of confidence and humility at the same time. Because like I said, I was not a big person. So it truly, like, being in constant physical confrontation with people and your ego's tested and you're dealing with other people's egos too. And all these things, it requires a great level of maturity, or it'll instill a great level of maturity in you to handle difficult situations. But no matter how confident you leave the day, there's still someone that can kick your ass. So you do still like leave like, hey, I feel really good about my capabilities, but I also know I'm not, you know, the number one in the world. Yeah. Because there's always someone that can beat you.
Definitely.
And so that's the beautiful thing. It's like, it has taught me how to deal with difficult circumstances, how to stay in the moment. Because when you're rolling, you're in a bad position. Someone's smashing you. They're about to submit you. You have to just focus on the problem at hand. I mean, you don't really have another choice. You can't really ponder your taxes or your fight with your girlfriend or anything like that. Yeah. Like you're all right, this guy's about to rip my arm. Like, all right, let's figure out the game plan, or let's tap and just like accept it for what it is. And so I think if I were to summarize one major thing, it would just be to like the confidence to just deal with difficult situations. That's
definitely, it's helped me a lot in that too.
Yeah.
You know, just dealing, like now when I do school or like when I have finals, I'm not stressed. Yeah, exactly. Like I'm not worried about it at all. Like I've literally had people try and rip me apart.
Yeah. I always tell people that when I was at grad school, cause I was like one of the people that would get like the least kind of like worked up about little things, like a test or something like that. People are like, why are you not freaked out? And I'm like, dude, I would do it at 6 a.m. So I was like, I just had a gorilla trying to like rip my neck off. Yeah. And I figure that situation out. Like, I think we'll be fine with this pop quiz.
Yeah.
It's going to be okay.
Yeah.
You know what I mean?
That's a pretty good analogy, man. I mean, you literally have a gorilla trying to rip you apart and then you're like, okay, no, I got to go live. It's like things after that get like kind of minimized. Yeah. Like stress becomes optional.
Yeah. I mean, the other really crazy thing too is you're doing something so primitive and vulnerable and intense with people, yet somehow we still have this like golden rule that if you tap, like it's done.
Yeah.
Like this isn't like violence. That's just like we like to say rip each other's arm off because it sounds sexier. But at the end of the day, like we're all just kind of like a bunch of like really happy go lucky, like guys on this mats that are like, you know, like we're super respectful of each other. Like, yeah, we're a bunch
we're like all friends.
Yeah. We're all savages. And like, don't get me wrong. Like we get down and like, you know what I mean? Like some of the people there, like they're basically assassins at this point.
Yeah.
But at the same time, like it's all chill. Like in that thing, the crazy thing too, is like a lot of these people that I hang out with, I would have never hung out with them if it wasn't for jiu-jitsu. Like from political beliefs, from age, from lifestyle, like nothing matches, but we can all get along because we agree that like, hey, no matter who you are, at the end of the day, if you tap, like I'm going to stop because I care about your well-being. Like, I care about your well-being. I'm not here. This isn't a fight. We're here to just use each other to grow. That's it.
Yeah.
And so to me, it's amazing because it's like, yo, like that little golden rule there is just like creates this like little safe zone. And then when you're like, hey, if you and I can try and wrestle around and ruin each other's joints and basically play this game of death with each other.
Game of death.
But at the same time, be like, hey, I'm going to respect your boundaries. Like, yo, what else can't we just like talk and figure out?
No, definitely. Yeah, for sure, dude. I mean? And like when people get irritated about talking about certain subjects or like, you know, even political stuff now, it's just kind of crazy, man. Like, and then, you know, you see people like us and, you know, we're on the mats and, you know, 5 minutes, you know, we're trying to strangle each other for 5 minutes and then, you know, we shake hands and hug each other. It's like, I wish people would do that more just in life, you know? I think that's why, jiu-jitsu for me has been a bridge to, understanding people and kind of expanding my circle, like, and not even just like circle of friends, but circle of beliefs, you know, like it's opened me up a lot. Yeah,
dude. I mean, it's hard to describe in words everything that it gives you. Yeah. But like, that's why I always tell people, I mean, I've done stunts, I've done breakdancing, I've done rock climbing, kickboxing, tricking, surfing, snowboarding, all the ball sports you did as a kid, all those things. Like I've gotten to every hobby and I'll tell people if they're like, which one should I do? I just go jiu-jitsu. Like do that one first. Like, if you don't like it, it's okay. It's not for you. It doesn't, you know, make you less of a person or anything because everybody has their thing that they vibe or don't vibe with. But if you do like it, it will just send you on a different course.
Definitely. Yeah. And I think getting over the original discomforts, like I was very uncomfortable when I started doing jiu-jitsu. Like, you know, the idea of literally being in between another dude's legs was kind of confusing to me. I was like, that's a little weird. And then I was like, oh, wait, but it's not. Like, you know, it makes sense. This is like where you would end up in a fight or like, you know, just getting past the original barriers for me was like really big and, you know, being interested in it. Cause like I was telling, you know what? I actually won't include that. I'll tell you after that. It's a good story. So I also wanted to ask you about your competition. You know, when you were doing competitions for jiu-jitsu, what was the mindset that you developed going into that?
Man, so I was very ignorant as a white belt. I'll say that because I did 4 competitions as a white belt and I won my first match ever. And then after that, lost every match as a white belt. Yeah. So I won so funny enough, it was my first tournament and I had a stunt gig that night and it was a night shoot. So the tournament was like 9 a.m. in Orange County or whatever. And I got off work at like 5 a.m. So I had like barely slept. I got an hour of sleep. My mom was so worried about me that I didn't sleep. She like drove me to the tournament, blah, blah, blah. I slept in the car a little bit. Our Professor Rodrigo wasn't even there yet. I did my first match and just like did great. And then as soon as he got there, I got smashed like every other match. So every match that Rodrigo has seen me do, I've gotten smashed at. So I just went in with a lot more like humility because I kind of went in thinking like, oh, I'm the stunt person. Like I know like how to do all these cool flips and stuff like that. I know it's a different thing and there's really good people out there, but like I'm feeling pretty good about my jiu-jitsu. Got smashed again, got smashed again. And the funny thing too is like, I don't know, I really wanted my friends and family to be there and see me win and have that kind of like pivotal moment where I look at them and I'm like, yeah, like I won. And like, blah, blah,
and the champagne.
And the champagne. And the beautiful woman that just like, you know, who like magically appears and like is swooning for me and my nasty gi and, you know, haircut and whatever, looking like a fucking mess on the podium for like this 50-cent trophy. But I always had that little like kind of like dumb mentality. And then I just had to be like, all right, man, like this is, you're causing way too much stress about this thing for like this 50-cent trophy. So I kind of let it go. Then when I was a blue belt, I was now at Gracie Baja and at some point I was just like, you know what? Like, I just feel really unsatisfied. Like, I want to get after it. And so I did a blue belt tournament and I just did awesome. It was my day that day. That's what I like to tell people, because I think some days is your day, some days is you're not. So I had a good day. And then, I won gold. It was like 3 matches. 2 of them were submissions. One of them just like, wrecked it on points, and was really stoked. And then I did one at purple belt. So that was the only one I did at blue belt. I did one at purple belt and it was just 1 match and got smashed. And I kind of am not really competing nowadays as much, just because honestly, my time, like we talked about at the beginning, is so limited, and I love the competitive aspect about jiu-jitsu, but I have no intention of being a world champion, ADCC medalist and something like that. So if I have a free day off, I don't want to deal with the stress of a competition. So I'd rather just go to training and surf and do all these things. Like, I love doing dope shit, but I don't need to win a jiu-jitsu tournament to feel fulfilled. So I kind of, as of now, I don't have any intention on competing again. But yeah,
that's good. Yeah, no, that's, at least you've done the tournament, and at least you did well, and you had that moment.
Yeah, I don't feel like I would, like, oh, what if it's out there? Like, I'm like, oh, I did it. No, I'm good.
Yeah. And I think that's important. I think, for me doing that, I kind of proved to myself like where I thought I was, in jiu-jitsu. Like, I was roughly pretty close. Like, I was pretty close to where I thought I was, and that was good for me, because going into it, I wasn't very confident. Like, I was pretty terrified. I was alone. Like, I didn't want to go with any of my family. I didn't want to have anyone around me in case I failed. And, that was just kind of like something I wanted to deal with on my own. And it worked really well, not having to worry about people. And, it didn't stress me out. And because I've always kind of had that same kind of grandiose, vision of, champagne and winning and stuff like that. And I just kind of told myself, I was like, look, man, this is not the time to think about stuff like that. So, going into it, that's how I prepped. And
it's the same thing. If you focus too much on the results and not the steps you need to take, you don't have any energy, and you're not doing the work. Yeah. You're just spending way too much energy wishing something would happen.
Absolutely. Yeah. And, the days up until the competition, I was writing flow charts and, making sure I kind of knew what my game plan was going in, and being able to do stuff. And, I got 2 submissions, and that was really awesome. And, getting second place, I was very happy with that. And, I think, considering I was on my torn meniscus and I had a scaphoid fracture, I'm fairly happy with how I did. Man. Thank you. Good. Yeah, I'm fairly happy with how I did, and I think I want to come back and I want to compete more. And regardless of if I have a screw in my hand or not, I'm really excited about doing it again and getting back into it, because it made me more aware of the things that I need to address, like holes in my game.
I agree. I mean, I'll say, like, first off, very commendable for going through that. And, like, secondly, it kind of even puts into perspective, like, hey, we would not have known each other if it wasn't for jiu-jitsu. Yeah. And it reminds me of how many awesome things that jiu-jitsu indirectly brought into my life. Like, I got into surfing after I got into jiu-jitsu. Jiu-jitsu actually got me into meditation. There's so many amazing things that it brought for me indirectly, probably from the people I was around and stuff like that too. So it's exciting. It's exciting to be like, hey, I'm seeing you at your white belt career, and who knows where that's going to go down and what we're going to be doing in a year and all that stuff.
You'll be teaching me leg locks in a year.
100%. just don't tell anyone, okay? Because I know it's very
no one's
secret.
Listening.
Yeah,
no one's listening. But that's.
I'm excited, man.
I'm excited too, bro. I'm super excited. And do you have any tips for me, like, going forward?
No, actually, you're doing good. Like, I haven't rolled in a while, but I'll tell you, man, it's the marathon game. Like, me and Cam were actually talking about it about you. We were bragging about how intelligent you are, especially for your age, and how, like, into it. So I know you're going to be humble.
Depends on the day.
Yeah. But hey, we all have our days.
Thank you.
No, but we were like, dude, that's crazy. This kid is doing all these awesome things. Like, you teach me about stuff, you know what I mean? And so you have a natural gift inside of you. You've got talent, you've got drive, you spend your time researching the brains, all that stuff. Whatever you set your mind to, you're going to do. I can speak for jiu-jitsu. I can't speak for medical school, but I'm pretty sure it's safe to say that both of those things are a marathon grind, right? Like, they're not things that come overnight, and there's going to be rough days. There's going to be rough weeks. There's going to be rough months. But you just have to know that if it's something that you love, you can do it, and you can revolutionize it. So, like, just don't stop, because honestly, there's nothing that I see from you that I'm like, worried about. And if anything, most of the things I'm rather impressed, and I'm just like, wow, this guy knows so much about these things. And not only do you know things, you're taking initiative. Like, it's one thing to know about these peptides. It's another thing to be like, I'm going to do it. Because a lot of people wouldn't.
Yeah.
And, you know, like, I don't know the research as to whether it's a good idea or not, but what I will commend you for is, hey, you're doing it. Like, you did your homework and you're going to go for it. Because that takes guts. Like, at the end of the day, you have the intelligent and you have the tenacity and the willpower. So whatever you set your mind to, I have no doubt you're going to be successful. And I'm probably going to be bragging about you, or we'll be on this podcast in like 10 years. And I'm like, I told you so.
I'm very grateful for the kind words. I appreciate that very much. And, you know, I'm like I said, I'm just happy to be here and be around such great people. And, you know, I'm very thankful for everything jiu-jitsu has done for my life. And, you know, for even, you know, introducing me to people like you. Like you said, I probably would have never met you if I hadn't done jiu-jitsu. And, you know, that's one of the things I'm trying to get across to people is like, whatever it is, you know, try jiu-jitsu. It's definitely worth it. Yeah, as our instructor always says, jiu-jitsu the best. Jiu-jitsu the best. Jiu-jitsu the best.
Let me ask you this to close things out, because I feel like we're like hitting this really nice this point. Because we're also ending the year. What is something, when you reflect back on your year of 2021, what is something you're most grateful for?
Ooh.
Doesn't have to be most, because I know it's always a lot of pressure, but is there something that you're notably grateful for?
People. I'm so grateful for the people that I'm around, and, you know, guys like you, guys like Cam, everybody at the gym. It's quite a nice change from how things used to be for me. I used to not be around a really great group of people, and, you know, lots of drug abuse and lots of, you know, all kinds of crazy stuff that happened in this group. And, you know, it's a really nice change to be around such good, smart, driven, you know, really lovely people at the end of the day. And, you know, just the things that you guys do for me, and, you know, even things that you probably don't even notice, like, you know, when you're super kind about when I get injured and you're like, oh, don't even worry about it. Like that, you know, is a huge psychological shift for me. And that, those couple of words make a really huge difference in the rest of my day. So, you know, I'm grateful for people like you and for, you know, people at our gym. And I could name names for 2 hours. Yeah, but
no. And same for you, man. Like we're so grateful. I mean, to have you, because like everything I said before, man, you bring a really, really unique light to the gym.
Thank you. I try. I do try. No. Do you want to end this transmission? You got anything else to say?
No. Yeah. Let's do it. I think I'm sure there's more to talk about, but
we'll have you on. We'll have you on again.
No, I know where you live now.
You do. He knows where I live. He does know where I live.
And we'll be physically fighting a couple times this week. So,
yes.
You know.
Yeah.
Yeah. I just want to say I'm so grateful to have you on, and I'm so impressed by you again, man.
Thank you, bro.
It's really an honor.
Thank you very much.
If anybody has questions about physical therapy stuff, you can find me. My handle is just at Shayan Safar on Instagram. It's Shayan Safar. You can just reach out to me and hope to answer some questions. Or this guy, because he probably already knows the research on it.
Not PT, bro. PT's all you, man. That's all you. I'm not gonna step in your wheelhouse. But yeah, thanks for coming on, Shayan. It's been an absolute pleasure. And to everyone listening, thank you again. I really appreciate all the support. That was the Inhuman Performance Podcast, episode 2. Woo. And that was Shayan Safar. Thank you very much.
Thanks, man.